Dan, I'm glad you could be here. Glad you could join us.
My pleasure.
Yeah, I first want to say to everyone listening, like, you are my doctor. And it's really cool. The first time that I went to see you, I heard about direct primary care, and I was like, all right, let's check it out. Let's see what it's all about. And I was blown away by just how simple, easy it was, how laid back you were about the whole process, about doing the patient visit, about talking to me, and you weren't in a hurry to get out of the room.
Yeah.
And it blew me away. I felt so calm and relaxed.
Oh, good.
And that was the first impression I had with that.
Awesome.
So thank you.
Yeah, that's definitely the goal. So it's very different from the whole insurance world where it's kind of a cattle call and just try to run people through. So
yeah. So for those that don't know, I don't want to butcher it, but like, what is direct primary care? And let's talk about that.
Well, direct primary care essentially is a model where the physician does not accept insurance and deals directly with the patient. So there's no middleman, and that's the direct part. In addition to not having a person in between the two of us, I also have direct relationships with suppliers. So lab tests that we do, you pay what I pay. So nobody's in the middle, eating your piece of the pie, as it were.
Yeah.
And so when I contract directly with labs, then the price is probably 90 to 95% less than you're used to paying in the insurance world. So instead of $450 for a panel for a physical exam, it's $15 or something like that. So if I give you a shot of Rocephin, it's $1.79, or a strep test is $1.25. Kind of just silly prices, and it just kind of demonstrates or illustrates how jacked up prices are in the insurance world. So I first learned about it about 2014 or so. But prior to that, I had attended a dinner that was, I guess, a presentation dinner that was put on by MDVIP, which they bill themselves as the affordable concierge company.
Okay.
And prior to that, I heard the word concierge, and it sounds a little uppity, and I'm like, not for me. I don't mind taking care of people that are wealthy, but that's not why I went into medicine.
Right.
I wanted to take care of the people who perhaps needed me the most. So was surprised when I received this really cool invitation in the mail in 2011. And it said, hey, come down to this 5-star restaurant in downtown Dallas and bring a guest. And in the medical world, you're not really allowed to do that in most settings, especially, something that's sponsored by a drug rep or something. And we'll pay you $300. And I'm like, sweet, free date, nice dinner, $300 in the pocket.
Yeah.
So I just kind of went, and I was curious because, the insurance world, had been practicing for 10 years at that time, and became very apparent very early that insurance got in the way of me being able to take care of my patients the way I wanted to. And it just got worse year after year. And so I go to this presentation, and the doctor who is there, the person who they, I guess, had there to do their advertising for him, talked about an exorbitant amount of money that he was making and only seeing 7 or 8 patients a day. And my thought was, I could live off of that, but that just, again, wasn't for me. So I was just enjoying my salmon and just kind of waiting for the time to expire. And then all of a sudden he said, and we're seeing better outcomes. And I'm like, squirrel, wait, what? Okay. Now I'm intrigued.
Yeah.
And it makes sense, right? Because you're taking more time with the patient and more personalized care. So at that point, I decided, okay, I'm going to try to figure this out. The reason they make so much money is because they also bill insurance. So they were charging $180 to $200 a month, and I thought that's just too much for the average Joe. But on top of that, they were billing insurance. And so right then I set out to try to develop a model. And the goal was to try to reduce the amount of time that each patient required of me, kind of get rid of the fluff, the spa treatments, the house, in-home visits and things like that, and try to therefore allow for a larger patient panel and therefore bring the per patient cost or per month cost down. And my goal was $50. I thought, who can't afford $50 a month?
Mm-hmm.
And so I figured I'd have to probably have a panel of 750, 800 to do that. And for 3 years, I designed and tweaked and had ideas come and go. And then in 2014, I learned that I was not a pioneer. There was a movement called direct primary care, and I jumped into that world, went to conferences and saw what was working, what wasn't, again, continued to tweak my model, and then finally jumped ship. And I'm the sole provider of a family with 6 kids, and so it was quite a leap of faith. But I had enough faith in the model and what I was doing and my wife, she was a hard sell, an accountant, very frugal and careful. And a funny story is after we got out of that meeting in 2011, we got into the car and she said, "So what did you think?" And I said, "Yeah, well, it's interesting, but really not for me."
Mm-hmm.
And she paused and she said, "Could you maybe just do it for a couple of years?" And I thought, oh my gosh, from her perspective and, struggling through residency and trying to, get the practice going, I could understand why she was kind of thinking it'd be nice to get a little nest egg built up.
Yeah.
And just wanted to kiss her on the forehead, didn't, because I was driving, but it was just kind of funny. But so we jumped ship, and, I didn't have a lot of money and took loans out and did whatever it took, borrowed some from her dad. My dad pitched in a little bit, but finally, after about 3.5, 4 years, I was able to get to the point where I was actually 2 years into it before I actually pulled out of going into debt further and further every month, and then finally hit that 750 mark about year 4. So usually it totally depends. I mean, other direct primary doctors, sometimes they get into an environment or a city where the employers are amenable to this for their employees, and so they'll get an account of 30 employees at once. And Flower Mound is very, I don't know, for some reason different, and they have about 10% self-employed, but they're all scraping the bottom, and so they don't really have a lot of money to put towards these kind of benefits. So I've only got a few accounts, and they're very small.
Mm-hmm.
But it's a hard sell. People are stuck in this insurance world, and it's really hard I've kind of figured out it takes about 20 to 25 minutes to help somebody kind of start to see the potential value.
Yeah.
And it's an obvious choice for people with no insurance. I thought it was an obvious choice for self-employed people that want to provide a good benefit for their employees. But, the people that are really a hard sell are those with insurance. But most people's deductibles are multiples of our yearly membership fees. And so probably 50 to 55% of my patients do have insurance. And plus they like the model because, again, easily accessible. You can do telephone, video, patient portal visits in addition to the inpatient or in-person visits, and usually just can get in either the same day or the next. And so it's working. I'm grateful. Feel very blessed to have kind of living my dream. I was 52 when I started the thing.
Oh wow!
And so 58 now, and I plan on sticking around for another 12, 15 years because I love it. I love going to work every day. It became less and less exciting and more drudgery in my old practice.
Mm-hmm.
And now I practice in Flower Mound, live in Flower Mound, so it's a 5 or 6 minute commute, better than 20 to 25.
Yeah.
Even though a lot of people I know who live in Flower Mound commute to downtown Dallas, and so I felt pretty bad when I was complaining about 20, but I love it. I love going to work and taking care of patients. I don't mind staying late, finishing up charts, and just I'm not very good at communicating with my wife about what time I'll be home, but yeah, it's good stuff.
I love it. As a patient, I'm sold, for sure. Because it's, I'm self-employed, and similar to the story of how you talked about you had to kind of sell your wife on it. I had to sell my ex-wife on it because I've got child support and I have to provide health care, just like any divorced parent that's non-custodial. And my, when I was working for a corporation, it's real easy. Child support comes out of the paycheck and the health care comes out of the paycheck, and it's all automatic, right? When you're self-employed, you have to manually set up a lot of this stuff. And so I started my business, and I'm researching, I'm like, to get the same health care that I had when I was at the company, it was $900, $1,000 a month. I'm like, dude, that's not a real number for someone self-employed to pay for. I mean, I'd have to have like a wildly, outlandishly successful company, and in the first year, that's not typically the case. So it's a lot of money to ask a fledgling company, one employee company with like a couple contractors. That's not a realistic number in my mind. So I started doing research, and I'm like, what can I actually afford? And so we'll fast forward. What I'm doing now is, you're my primary care physician, my daughter's primary care physician, but we have a major medical plan that we bought from like an insurance broker. I didn't even know these guys existed. I didn't know that was a thing. There's an insurance broker. I bought a plan from him that's like a good plan for major medical stuff. It doesn't cover anything preventative, but that's where you come in. So I've kind of basically customized my health care, and I had to learn like, oh, this is even an option that I didn't know existed before. And I just accidentally stumbled on direct primary care and found, hey, this is great for self-employed people. But I, like you were saying a minute ago, I absolutely advocate for anyone to do it. That's anybody, because the level of care that I've received, I'll give an example. It's my medical information, so I'll share it. But
I will not. I'll have to deny knowing anything.
But no, it's nothing crazy. It's just I came to you. I wanted the full panel, the physical, the blood test. We went over a bunch of stuff, but you spent like a good amount of time with me. I don't remember how much it was, but we like had a lengthy discussion about the numbers, about the stuff that I was feeling in my body, and we discussed a bunch of things. And I came out of there just feeling so relaxed, so confident and happy about where my health was, because you gave me that time. And I've been through the major medical physicals and the consultations and stuff, and it's fast food nation, it's just blasting right through the thing. And I get out and I'm like, I didn't get to ask even half the things that I thought I was going to ask. And even though I even wrote a list down ahead of time, the guy was just in and out, and it just felt like rushed. And now I still don't feel confident that is my health where it should be. But and then we did the labs, and then that came back, and it was like a full battery of everything that I could have ever wanted under the sun for like less than $30, because I asked for several labs, and so it was like less than $30 for that. And I'm like, man, my copay less than $30 for the labs, and I'm like. And now I feel very good about where my health is at. And so yeah. I mean, but you coming on as a guest, that was out of our discussion, because you took the time to get to know your patient. You took the time to like understand what am I up to in my life, and I talked about your practice, and I was interested in it and what you do. And then here we are talking today. If you had given me that 7 or 15 minute session, we never would have been sitting here. And so it's a more human experience, I think.
Well, and the model just totally saves money, because had I done what others had done, then you would have scheduled another visit or another visit, and or not scheduled a visit, and then your health may have deteriorated. And so overall, it actually saves money if you can just take the time that is needed to take care of the person. And then the more that I can make it so that you don't need me, the more healthy you are, the more money we save, et cetera. So we really do feel that, this is the solution to primary care, is we've got to kick insurance out. In fact, that's an important point to make. We kind of analogize, if that's a word, this to auto insurance. If you have a minor accident, or you don't expect to go to your insurance and say, hey, or not, maybe that's a bad example. Say like a tune-up or an oil change, or something goes wrong, your battery goes dead. They laugh at you if you try to go use your insurance for that.
Mm-hmm.
It's there for major accidents. And so, like you said, major medical. And so that's one important point to make is, and I do have patients who are, strapped for cash that only have me as their health care. And we never advocate for that. We try to do our best, but we really want you to have something there in case something bad happens. And most of us will recommend, and the route that you took is totally fine. Most of the time we'll recommend one of the health sharing ministries. And those have been around since the 80s. I prefer the one to which I belong is Christian Healthcare Ministries. You'll hear a lot of commercials for MediShare. MediShare is a little bit more like an insurance plan. And I probably don't need to talk about that in detail, but most of them are Christian based, but there's one called Sedera, which is not. And the Christian ones, they require some kind of a statement of faith. But we have a lot of Muslim patients and they're like, well, what about me? And so when Sedera came along, it was nice to just open up the doors to anybody.
Now, what is different about these ministry-based healthcare versus I'm going through a typical insurance company for my major medical? Like, what's the situation there?
Well, there's a link somewhere on my front page that has a link to. There's another physician, and it's called Oxna. I don't know if that's how you pronounce it. OCHSNA or something. Mm-hmm. Healthcare. That's another DPC practice and he has gone through and kind of compared all the health sharing ministries. But I don't think he compares it to the insurance broker type stuff, but there are a lot of similarities because, they have all kinds of criteria that you have to meet and wade through. And the reason I like Christian healthcare ministries is that it's a lot simpler. And the way they have it set up, and they do have a gold and silver and bronze, and you have to kind of say, okay, which one do I want? And each one has, different offerings. But the gold, which is the one I recommend, then they have gone up on their prices just like insurance has. But our family currently pays about $750 a month for the entire family. And the way that it's set up is that if I incur any kind of a healthcare expense, a new illness or an injury or something like that, if it's under 500, I pay for it.
Okay.
If it's over 500, they pay the entire bill. You don't pay the first 500, they just pay for it. And so, for instance, my wife was diagnosed with, and they have certain pre-existing conditions and stuff. But if you have joined before something happens, then, it's sweet sailing. And my wife got diagnosed, I think she's okay with me sharing this, with pernicious anemia, which is where she can't absorb B12, and had to go get an endoscopy, an EGD, and we just submitted the bills, and they wrote us a check for every dime that we spent on that, over $3,000 or so total.
It's interesting, because I've heard reports that some of these Christian ministry healthcare companies, they'll deny coverage. So you'll have families that have these kind of bad experiences. And I don't know if they're just picking on the bad examples versus all the good that like you just described, but I hear stories about like Christian ministry healthcare denying coverage. The little kid got sick and they denied that. I know you're not in that world, but is there anything you're hearing related to that thing? Yeah,
so the downsides, the pre-existing part is a downside.
Okay.
And they have like a waiting list of 3 years if it has to be declared cured or in remission or something, and then they'll start paying for it. And there's a lot of small print that you have to read.
Yeah.
But it is not a secured thing. Like in insurance, they have to guarantee a certain thing, and they're part of a larger group where they can absorb the different risks and stuff. So they always say that there's not a guarantee that they'll pay. But they have paid everything we've been through so far, and and I've not heard of anybody that for whom they've not covered the bill. But the other thing about it is that if you incur a bill that is a pre-existing condition, they've determined that it doesn't meet their criteria for coverage, then they'll send it out on this prayer page, and then other people are invited to donate to kind of cover their bills too. So I'd be interested in each individual case to know where it might not have been covered.
Yeah.
But I assume that they're, the reason our price has gone up every couple of years or so is that they're getting more people with these larger medical expenses and trying to cover those fully.
So, we hope that's the case, right? Yeah.
And so I would be surprised if they covered everything all the time. If they had some crazy cancer or something that required a drug and it was, $2.3 million a year, then, you can imagine that at some point they have to draw the line. But so far we've been very pleased.
What did, John, I saw you had something up there. It was Trust God or something. What is this?
This was a New York Times article about industries not covered.
So it looks like, you got that up? It looks like health insurance, but it's not just Trust God, buyers are told. So see, we'll keep talking, see if you can find the part why they were denied. Because I think people listening would probably be interested in understanding, why did they get denied?
Yeah. And that looks like it's written by somebody that has a little bit of a, interest or something in the insurance world. So.
Oh, did it?
Just the way that it was written, and Trust God, anyway. So I said, almost all of them are Christian based, but Sedera is not. So.
Yeah, leave it off the share,
anyway.
the picture-in-picture until you have. Let me know when you have something. But, yeah, for me, I feel. I don't know anything about them really, but I'd feel a lot more comfortable knowing I had an insurance company that when I submit the claim, I know it'll be, I know it'll be honored and granted because it's a covered thing. But I get it because it's probably cheaper to go through one of those, overall in cost, I guess.
Yeah.
Because you're saying anything over 500 is 100% covered. That's pretty awesome.
Yeah.
My mom had, breast cancer in the mid-90s, and she worked for Cirque du Soleil at the time.
Oh,
she worked for production.
Love that company.
Yeah, great. I mean, they've amazing performances, right?
Yeah.
You see that, and you're like, oh my God, I've never seen anything this cool. But because they have acrobats, professional athletes, acrobats on their staff, the healthcare for that company is ridiculous. I mean, everything's 100% covered, 100%. So all of everything, 100% of everything for all of her breast cancer stuff, and then she went into full remission or healing or whatever the term is. What is it? Remission.
Yeah,
okay.
Yeah.
So full remission and 100% cured and 100% covered.
Yeah. Yeah.
So that was pretty cool.
And that's rare, these days that you have a company, Microsoft, for quite a while. It was always 100%. And people who worked for Microsoft is kind of like you can order anything you want at any time and they would cover it.
Yeah.
And I think that's even changed now. But most of them require some kind of a deductible. And, they still, those larger companies usually have the smaller deductibles.
Mm-hmm.
But most people that, I don't know what the average is, but it's probably averaging at least $3,000 to $5,000 a year deductible now.
Yeah.
So,
what do you think the quality of life difference is? Because I know what it is for me as the patient going in direct primary care, and you described a little bit about it. But what is that quality of life change for you, shifting from the conventional experience of being a doctor to what you're doing now?
Yeah. So, one of the difficult things is in the direct primary care, the usual direct primary care world, and this is where I'm going to distinguish a little bit between what I've developed and what everybody else has developed. And, it's said that if you've seen one direct primary care practice, you've seen one direct primary care practice, because we all design it any way we want.
Okay.
And so the carrot that they hold out, I think it's okay that I talk about this. I don't think we have to cut it later, but I'll use some discretion. The carrot is that they hold out is call me, text me, email me 24/7, and it's it's kind of a concierge-like feel.
Sure.
Some of them describe themselves as concierge medicine for the blue-collar worker, or a concierge medicine for, an affordable price or something. Most of us kind of cringe when people compare us to concierge, because we're like, okay, we're very different. We're a lot cheaper. We don't bill insurance, and we, are there for the regular guy. But the carrot, and I'm confident that I grew more slowly because I didn't offer this, and I did a little mini study with family and friends and stuff. Hey, would you pay $30 more a month? And I'm one of the cheapest if you were to go out and look around. $30 more a month to be able to contact me and have no copay when you go in, or pay a $10 copay and have it cost this much. And almost without fail, even though it would cost them more, just not having to worry about a copay, they wanted to do that. And I'm like, that makes no sense to me. Patients don't need and to have you, dock in the pocket or something like that, as some people refer to it as. They really need to just be able to, find you in an emergency.
Right.
So what my carrot is 24/7 emergency cell phone access.
Okay.
So I give all my patients my cell number to text me, hey, it's emergency, can you call, or something, a little brief something.
Yeah.
Rather than call me, text me, email me 24/7 about anything. And then I'm on the Direct Primary Care Facebook page, and it's a phenomenal community. People put case studies on there, get the permission of the patient. They don't mention names, and hey, picture of this, what would you do? And it's a great community. And not just primary care doctors. You have multiple, mostly non-surgical specialties that have been, starting to develop a direct specialty care practice, endocrinologists or hematologists, things like that. And so they'll pitch in. You get kind of free consultations. It's really, really nice. But once in a while, I would see something on there, somebody complaining and saying, yeah, I was in the middle of a dinner out with my wife, and I got a call from a patient, and they wanted a refill on their Lipitor. Oh my gosh, can they not, use some discretion? And I'm like, did you not promise? Call me, text me, email me 24/7, and I'll pick up.
This is what you asked for, buddy.
You're paying for that. And I'm like, okay, so we're supposed to be under-promising and over-delivering. You're now over-promising and under-delivering. And so I'm like, that's not right. That's wrong. And so that's why I kind of tweaked my model. And, they talk about, and again, this is where I'm hoping I don't get too many people upset at me, but they say, oh no, most people are very respectful and understand that. And you just have to train your patients. And I'm like, whoa, what? Train,
That sounds weird.
And so to me, that was like not appropriate.
Yeah.
And again, I'll probably get my house, it's a respectful group for the most part. But anyway, so I just felt that I needed to do things differently.
Yeah.
Anyway, so I think I've drifted off on the answer to your question. Okay, so here's and then the other thing that was intriguing is that there weren't too many people that were making more than they were making out, when they're working for the man or the big box places.
Yeah.
And so, I thought to myself, okay, because I had my model that I've developed, I would love to expand, but I still haven't figured out the marketing part. How do I grow fast? I can't go and help somebody convert their practice into my model and tell them it'll take them 4 years before they make as much as they were making. You just can't do that.
Yeah.
In the regular world, you get guarantees, so you come on board and immediately you begin making X amount of money. And in the direct primary care world, some people have been able to do that by having a large group or developing a wait list. And then the person walks in and they've immediately got a source of income. Haven't done that yet. Haven't gotten there. But that's the original goal, was to do that and then develop kind of a network and then, you're in California and you need to see somebody, and you look up somebody in the network and you get the exact same care and pricing and stuff. But what I thought was interesting is that's not a very good sales pitch for me to go to a doctor and say, hey, you need to leave the insurance world, and you're going to be jumping out of the frying pan into the fire because you're going to be on call 24/7 with anybody, all your patients, with your cell number, calling you, texting you, emailing you 24/7, and you're going to make less money.
Yeah. And
I'm like, okay, I got to fix that, So I fixed one part, just haven't fixed the other part, or at least not in a quick way, So I've got these little ancillary things that I'm doing, and I have a lifestyle and weight management program that you talk about a competitive world, so that really hasn't done anything. So just kind of working on things, but for right now, I've been able to match the average, not like in the early 2000s. They were kind of the good old days. I'd love to get to that point, but I'm comfortable, and so I'd love to be able to give them a little bit more hope that they can do better than they were currently doing. But lifestyle is great. I still, check my messages. I get an email every time I get a message. And so after a few emails, I'll get on and at least one time in the evening before I go to bed, after, go home and enjoy my evening. I rarely get calls, rarely get texts, I should say. So it's really, I love the lifestyle. And then the other thing that I've got a kind of a unique scheduling system. You schedule, so you don't have to call and go, hey, this is Paul, I just need an appointment, or what time you back and forth. You go on to the website and, hey, this is available, click, and you schedule. And then I've got a buffer between each appointment, and then I've got a little block out of each half day so that I can address portal consultations. And so you have a little bit of time to look at the patient beforehand, and you have a little time to finish the chart afterwards. And so the flow of the day is so much more peaceful. Mm-hmm. And like I said, it's more enjoyable. And in the old world, you have one patient that arrives late, and that's another thing that the buffer allows. If a patient runs a little behind, you have that buffer. Yeah. And so, but in the old world, I call it, in my previous practice, somebody arrives 10 minutes late, and then it's a domino effect, and it gets further and further behind. And in the patient's perspective, they're like, well, every time I go, I'm waiting 20 minutes, so why should I show up 10 minutes early? Well, in this practice, I beg people to show up 10 to 15 minutes early so that when the time of the appointment starts, I can walk through the door and we get started. Yeah. And it's rare that patients wait more than 5 or 7 minutes. Yeah. And so it's nice for both parties.
Yeah. Luckily, I'll call it luckily because I don't need the doctor very often, but when I have shown up, I brought my daughter a few times, brought myself a few times for checkups and things. But yeah, the wait time is pretty short. There's not a lot going on there. You mentioned the nutrition stuff because I looked at you've got this nutrition star, and I thought that was really interesting. We got this up here. I'd love to hear you talk about it because if we go to the top. What is this? It's nutritionstar.org. Right. And I guess it redirects it to part of your TLCFamilyHealth.com. Yep. But go to the plate there, John. So this is typically what the government is telling us how in a typical meal, this is what your portions should look like. Right. So what is different about what you're kind of suggesting?
Yeah, so it's a good question. And, the star, of course, has 5 points, and you can see there are 5 sections there that are semi-equal, some a little bit larger than others. Mm-hmm. The main difference is and I have a fruits and a vegetables and a grains and a something that I call high quality protein and good fat section. And then the difference between those 4 things mainly is that they have to be prepared in a healthy fashion. Yeah. So, in the choose my plate thing, it says make half your grains whole. And I say, well, why not make them all whole? And they allow a serving of juice to qualify for a serving of the fruit. And I'm like, no
way. Seriously? Yeah.
They allow,
that's the plate?
That's part of it, yeah. And there are so many little, references and notes and stuff. And it's just this big complicated mess. And then I have this fifth section that I call the whatever.
I love that section.
And I call it the livability and flexibility section. And so, if you're paleo and you want to eat a lot of meat, you can eat 40% of your diet is meat, and half of that you'd want to be fatty seafood. And then whatever of the other stuff, you pick the things that you allow on your diet, certain types of fruits and vegetables and things like that. I have some patients who are like 100% whole plant-based, and they say, no, you shouldn't have 20% whatever. And I'm like, how about you fill that with whole plants, And they're like, oh, okay, that makes sense. But yeah, so I think it's just, I believe, and it even says right there, I've evaluated many recommendations.
Where is this?
Just right there.
First, Dr. Cluff has evaluated many dietary recommendations and determined that what kind of plant you eat within each of the plant categories is fat. Oh, I'm sorry. It's the end of the day. It's far less important than preparing it whole in a healthy manner. In other words, potatoes are healthy as long as they are not deep fried, which is how around 50% of all potatoes are consumed in America, or smothered with butter, cheese, sour cream, and bacon bits. And he says, why not make all your grains whole? What is, help me out here with the whole grains thing, because I see on a box, it's 100% whole grains.
Yeah.
I don't know what I'm looking for when I just know, hey, I eat grains, but what's the whole versus half? How does that work?
Yeah. So whole grains, you want to, and companies have gotten around it where they process it, they have it white, and then they color it, and then they add, grains from the outside, or not grains, fiber that, they kind of
tamper with it.
Yeah. They play with the system a little bit, but we don't have a real easy way. I've got another plan for that, but that's a whole other podcast perhaps.
Okay.
But, you're really looking for fiber. You want to have fiber, and then you want to try to reduce the number of simple sugars that are added. And so, probably the healthiest bread is probably like Dave's brand.
Okay.
They have Ezekiel bread, and those are too intense for some people. And so, again, if you're following that, it's kind of a 4-to-1 rule is how I don't think you need to stress about 20% this, 20% that, 20% that.
Right.
It's really just 80% generally healthy or as healthy as can be. And then you have a little bit of give to play with. And so, our family enjoys, and I'm hesitant to say this because if they fly off the shelf, then I won't be able to find it. But, we like honey whole wheat Pepperidge Farm bread.
Okay.
And all my kids are all converted to it. And so, we'll still buy the white whole wheat, and that doesn't, fly off our shelf as much.
Honey whole wheat Pepperidge Farm.
Yeah.
Okay.
Okay, just edit that out. That part out.
I want John to write that down.
And I can't remember if it's 2 or 3 grams of fiber per serving. But at least 2, and preferably 3 or even 4. And that's where you're getting more and more health with it.
Can we let's pull up this star again one more time, because also I know there's listeners. So what we're looking at is your TLC Family Health. If you go to nutritionstar.org, and then it forwards you to his website, but it's a star, typical 5-point star. In each section of the point, there's a different category. So you get your vegetables, fruit, whole grains, high quality protein, and good fats, and whatever. So what you're suggesting here is an equal distribution of all of these.
Or again, and I don't really want you to stress too much. It'd be nice to have a bit of that on each full meal, but you can do that like in a day or in a week or something like that. And that's where you just kind of want to get most of the nutrition, have a balanced diet. But I'm less worried about that than just kind of whenever you snack, just make sure that one of your, in a kind of a 4-to-1 ratio, your snacks involve a whole plant or
I see
fatty seafood or something like that.
Yeah. What's an example of a whatever that I'm not going to feel totally terrible about?
Well, so depends on what kind of diet you want to follow.
Yeah.
So if you're a paleo, then you'd probably put some kind of a high, animal protein, high fat thing, bacon or something like that.
Yeah.
Whereas if you're a vegetarian, you might put ice cream in there, or if you're vegan, then you'd probably put some potato chips or something like that. Or, if you're the SAD, which is most people's standard American diet, average American consumes about 6% of his or her diet as whole plants. So we've got a long way to go. Then you'd put pizza in there, or a burger or something like that.
Okay.
For me, you can have a really pretty healthy burger if it's got mostly plants and whole grains, and not a ton of cheese or fried pickles or, bacon and stuff on there. But you do have to give up some of the really highly intense, flavorful foods in order to become healthy, or at least shrink the volume down.
Sure.
And the good news is that the more you follow this, the less you have to worry about how much you eat. It's estimated that 15 to 20% of the calories of a plant that you eat is actually burned as the body converts it into fat. So you actually get to eat that much more volume, more calories, the more you can follow a healthily prepared, mostly whole plant and fatty seafood-based diet, which is a mouthful. But
yeah.
That's kind of
Say
the
that
summary.
One more time. Say that one more time.
Yeah, a mostly whole, and again, the word mostly is critical.
Sure.
And, I have to probably find this for you, but I'm a big fan of whole plants. Okay. Now, what does that mean? Well, it doesn't mean you have to have like the whole apple, but as long as you're not taking the stuff out. So I believe that probably the least healthy thing on the planet is something that I call plant waste. And most people hear that and kind of, what does that mean? And that is an original. Actually took 3 weeks to come up with the name. It doesn't sound terribly difficult to come up with, but it's essentially taking all the good stuff out and eating what's left.
Yeah.
And the three things that make a plant healthy are water, fiber, and micronutrients. So sugar, which comes from a plant. So if I'm a vegan, it's on the menu. So vegan doesn't mean health. It is true that vegans are far healthier than the average Joe, but I try to leave the V words out of the health conversation.
Yeah.
If you're a vegan for philosophical or religious reasons, I agree with some of that philosophical stuff, but you're actually going to turn off the people who need the health the most. And so I say, let's pull the V's out of the health equation, put them together, and create a W, which is whole.
Okay.
But yeah, so the
it's clever.
The whatever section, another W.
There you go.
Is what makes it a mostly whole plant and fatty seafood based diet, and then with the 20% whatever. So that's the summary of it.
I've got a routine I do. I'll make smoothies pretty often. Not all the time, because I understand if I take a fruit and I blend it up, I'm consuming that sugar pretty quickly, and the body's not generally meant to do that. So I'm aware of that. But I'll pack in carrots, beets, spinach, celery. I'll throw in a bunch of veggies. And I know what cucumber's technically a fruit, but I'll put in some cucumber. Avocado is a fruit, but that's good fat, right? So I'll throw stuff in like that. Then I'll have a mango, a banana, and an apple, or maybe a pear or something. I like the texture of either of those. So that'll be like my fruit smoothie. So I recognize I'm getting all that fiber, and I'll throw the whole fruit, right? The whole vegetable, seeds, stems, the whole. I won't cut all that out. I throw it all in. The blender's powerful, chops it all up. Tastes nice and thick. Got a lot of pulp. It's great. So no juicing. I'm not leaving behind all that good stuff. So is that in your mind? Is that you think that'd be like that's okay, even though I'm taking in all that sugar at one time?
Yeah, so, many people would say, you're a family doctor. What do you know about nutrition? And I say, well, I just know what I've learned from pioneers in the field that have really become experts in the world of nutrition. So, I just kind of say, I understand your skepticism, but try it out. And I could lead you to books and people that would support with pretty hardcore research the things that I recommend. But from what I understand, if it's the sugar is part of a whole plant, then it buffers the insulin response to a degree that it is actually good for you. Because again, you're maintaining those three important parts of the plant. It's when you pull that out and just do a spoonful of sugar that you just, incite an inflammatory response, leads to disease and all those kind of things. So I disagree with endocrinologists, dietitians, who say you need to cut back on those more sugary fruits. And again, this is not me. This is quoting and following and then seeing in real life what works and what doesn't in patients.
Mm-hmm.
And I've had patients, my sister's an endocrinologist or my sister-in-law or something, and they say you're nuts and you really need to change your primary care physician because it goes against everything. I say, just experiment with me. And again, this is not me. This is me based on all these pioneers and studies.
Yeah.
And I tell people you don't have to, reduce your banana intake to a half a banana a day or a small handful of grapes or whatever, some of those more sugary types of plants. The more, the better. And I haven't lost that battle yet. I've had people come back and, oh my gosh, I had no idea that.
Is there something we can look at? You have a reference on that, like the processing of sugar?
I don't know if
I don't mean to
have
put you on the
something
spot.
specifically. Yeah, no, I mean, I'm sure I could find it, but
okay.
Yeah, there are again, it depends on who you read. And what I have learned in no uncertain terms is that nutrition is a lot like religion. If you've spent a lot of time researching and you've concluded, good luck changing the person's mind.
Yeah.
And the thing that a major point that I have, and there are paleo and low carb people, and there are more plant-based people, and you'll lose weight on any diet that you actually stick to. But normal weight or maintaining a healthy weight is not perfectly synonymous with health.
Mm-hmm.
If it were, then we'd tell everybody to smoke. So what you take into your body...
Right. Smoke crack, man. You'll lose weight. You're going to lose weight.
and I've often told people, I say, I'm grateful we have obesity, because if we didn't, then nobody would care about how we ate, because all we care about is how we look. And so if you're going to actually have normal weight plus longevity plus health, then it does matter how you lose weight.
Mm-hmm.
But even I've even spoken to some really, pioneers in their field of endocrinology and stuff that just flat out disagree with that statement.
Yeah.
They say, as long as you lose the weight, then it doesn't matter how. And I'm like, okay, but what about this? No, that's all. And they have to explain it away in some form or fashion. But
yeah, you're absolutely right. When you form an opinion about a thing and you're part of a club, and everyone in your club is echoing that same thing, it's really hard to see outside of that. Yeah. And in a way, that's part of why I appreciate you being not necessarily in working for the man, right? But you're still connected to, like you said, that Facebook group, and you're connected to other doctors, and you're obviously doing research because you have this nutrition website. So I appreciate that. And that was my curiosity specifically about the smoothies, because I know if out of what I eat in a day that's considered healthy, we're not going to talk about the processed sugar that I eat, but
we're all guilty. Yeah,
the Snickers ice cream sandwich, man. We're not going to talk about that.
Whatever.
Yeah. Whatever. But in the smoothie, what's considered healthy is, I'm like, well, I know there's a lot of sugar in that at the same time, but I assume, there's fiber, and I know that I'm probably doing well there. But because I am getting some kind of insulin response, is that still okay? But you said test it out and try it. I've been doing that for years, and I feel freaking amazing on the days I have those smoothies. Not just for that short-term period, but throughout the day. I don't need a coffee. I don't need any kind of stimulant. I'm feeling great throughout the day. My stomach feels happy.
Yeah.
And so when you reaffirmed just now that, like, I was doing the right thing, I had this little kind of guilty, I'm doing it right.
It feels good.
Something to affirm that I wasn't screwing up.
Yeah. So endurance is one of the most amazing parts of this type of a diet. You don't have the ups and downs and the crashes and the burns and stuff. And there are all kinds of like records and stuff that are set by people who follow a diet like this that you would just kind of say, no, what? And I'm sure some people would say it was like a sales pitch or something, but the Guinness Book of World Records person who's done the most reps of a certain weight is like the 67-year-old guy. And then again, I'm going to start, I could throw names and resources and stuff at you, and these aren't studies per se, but anecdotes sell, unfortunately. Sure. But that's what people use to sell things. And but there's a documentary, and again, I've even looked for criticisms of this documentary, and you can find them everywhere. But it's called Game Changers, and they show a gentleman, the person who is doing this documentary, that rope,
the battle. Yeah, pull this up on YouTube. Go to the Game Changers
rope thing.
Battle rope on YouTube. This guy for an hour, right?
It's kind of hard to argue, and he even said that I wasn't even tired. I just could keep going, but I had other things to do.
See if we can, get a little volume on it. We can take off part of our headphones and hear it. Oh, is that it? I saw the picture of him.
Yeah.
What's his name? James. Well, that's the picture, but it showed someone else.
And I don't know if you saw that, but a little thing that said "Game Changers Debunked." Again,
you're
really? Going to see things from both sides. But
see if you can find
James Wilkes.
Yeah, that first video didn't have it.
So did he lie? I mean,
dude, James Wilkes in the search there, like James Wilkes battle ropes. There it is. Is that it? That looks like.
The first one's a review of it.
I don't think that's the one from the movie, but this looks like the guy. You can go into it. Oh, this is just some guy named James. I don't think we're gonna find it. It's probably copyrighted or something.
And I'm open. I'm always learning. I'm open to the criticisms and trying to see, okay, what's real and what's not real. And
yeah, sorry, I didn't mean to sidetrack you there.
No,
but
you're fine.
Go ahead. You were talking about he had the battle ropes and the health.
So if it's true what he said, it's pretty convincing. And I can't remember that, like in that gym, that the record was under 20 minutes or something, and then he just kept going and going and going.
Yeah.
But again, I'd be very curious to see if somebody's actually debunked that and if he lied or something. But I wouldn't think he would.
No, I don't think he did. I watched. He was on a couple podcasts where he got into some discussions with people about it, and there were people in the gym. I mean, you would have seen something about people saying, "No, he's full of shit. He took a break or something." But an hour of battle ropes is a serious accomplishment.
Yeah.
That have you tried battle ropes? Like,
so you can look at me and tell me how much time I've spent in a gym, but I've never ever lifted. No, I actually have. I've kind of lifted them up, and I'm like, that would be
No, it's an amazing workout.
Yeah.
For a big portion of all your upper body muscle groups, your core. I mean, you
imagine
when you sit back in it, so you're engaging your glutes. I mean, it's a full body thing. But I mean, try to go past 5 minutes.
Yeah.
And you're smoked. I mean, it's a great exercise.
Well, let me just I'm going to try to do a Reader's Digest version of this because I could talk a while about it. But so I had prostate cancer, and I learned so much during that period because prior to that I had gone to a conference that suggested that you might actually be able to reverse prostate cancer with a whole foods plant-based diet. And I started to say this earlier, but I've actually written a little article for one of the magazines in Flower Mound a couple of years ago called My 7 Beefs with the Plant-Based Movement. And I generally, you can see I'm mostly whole plant-based person.
Yeah.
But one of the beefs is what the F is that F doing in there? Because whole foods plant-based, just call it whole plant-based. Because then you think of the Whole Foods market, which is so far from Whole Foods that it's just kind of this F word that needs to go away.
Yeah, we can have a whole conversation about Whole Foods, the grocery store, that has significantly declined in the quality of their food. But go ahead.
So I followed a whole plant and fatty seafood-based diet for a year. And, it's amazing when you envision every gram of something like sugar or white flour is feeding your cancer. And that's the only thing that motivated me. I mean, right now there's no way I could ever do that. But I went a whole year doing that. And during that time, so this is where we get personal. I hope people don't get offended. But one of the things that just like shocked me as a 50-year-old man is the endurance of sex. And they don't talk about it a whole lot because it's like a, taboo thing. But I mean, totally changed. It was amazing how, like, okay, I'm getting tired now. And that sounds like I'm sharing way too much. My wife would just cringe.
Oh, this
but
is good.
During
Men
that
need
time,
to hear this. Yeah.
During that time, I mean, you talk about no more need for Cialis or Viagra and stuff. And in Game Changers, they actually do talk a little bit about that. Again, it's a urologist that conducts this little study. It's a small sample size and stuff like that. But I'm telling you, it's real. And I've, patients who have had the discipline to really go all in have noticed a difference. And I actually I have all these ideas, and some of them are like flash in the pans, and others I want to pursue, but just don't have the time. But if you go to 4d4d.org, I think, and it directs you again to a page on my website, Saving Money, and it's the 4-day 4-diamond challenge. And I call these the 4-diamond foods. And so it's essentially leaving the whatever out for 4 days.
Okay.
And just see what happens to, go ahead and scroll down if you don't mind, to your weight, blood pressure, blood sugar, and it's tucked in there, erectile function. But I've seen my blood pressure during that year, my blood pressure, when I went into the dentist's office, I know they have that white coat hypertension. I'm no different. I'd go into the dentist's office and my blood pressure was, 30 points higher. Usual for me was 135 over 85. And I'd go in, I'd get these 160s over 100 something. I'm like, oh my gosh, this is ridiculous.
Yeah.
And about 3 months into my prostate cancer diet, I call it, I had a dental appointment and I was behind, and I hate running behind, and I called and I said I'm going to be a few minutes late, and then I hit lunch hour traffic, and I pulled in about 9 minutes after I was supposed to be there. They rush me in, they plop me down and throw that blood pressure cuff on me.
Hold on 1 second.
Yeah.
Are we good? Oh, it looked like you were signaling over.
Oh, that's right.
Oh. Go ahead. So the blood pressure.
They throw the blood pressure cuff on me. I'm like, okay, great. And it was like 106 over 63. Ooh. And I kind of went, what? I'm looking at this wrist readout. I'm like, and I'd read books, and there's a book called Eat to Live that I've promoted. I actually wrote a book in 2006 called Svelte Life. Don't get it. It's before I kind of discovered this new way of looking at it.
He was about to pull it up.
Yeah. You could probably find it on
Svelte Life?
Amazon.com. Yeah. SVELTE.
Svelte?
SVELTE.
SVELTE.
LTE. Yeah, you got the T and the L.
Yeah, switch the L and the T there. Svelte.
And then all one word, life. Just put life on there. Svelte Life. There it is.
There it is. So this is the book we should not get now, based on your new...
And look at all those ratings. My sister was one of those, But look at the...
Humble beginnings.
Highly in demand. How expensive that is. It's just you can't find it, but...
No, so
anyway.
So you started out writing that, and now you're saying that's bad info now?
Well, it's just older kind of, it has a lot of good stuff. I mean, most of it's still valid, but it doesn't have my nutrition star. It doesn't have kind of the newer stuff that I learned in 2011 through 2013 or so. I'm trying to work on another book, and the book called How Not to Get Sick, 10 Critical Keys for Preventing Disease, and that'll be out in 2040.
Yeah.
At the current pace.
2040. Well, if you can drop somebody's blood pressure that significantly and
Eat to Live,
increase erectile function, I mean, those two things alone, I think, are
major selling points. Yeah, but Eat to
Yeah.
Live, Dr. Joel Fuhrman, when I discovered his book, and again, all kinds of potential criticisms about that, but when I saw a video of his stuff, I was so sold that I bought the book. And when I saw the book, and at the very bottom it says, lose 20 pounds in 6 weeks, I went, oh my gosh, another diet.
It's gimmicky, right?
And almost threw it away.
Yeah.
But I'm glad I didn't, because it's actually real. And
Okay.
so I became so convinced, I started recommending it to my patients. And some television station got wind that, hey, Dr. Cluff had written this book, but don't read his, read this one now. And I had a little television spot. It's probably out there somewhere.
Yeah.
But, I started getting people convinced and selling people, and people would read it. They'd get convinced, and they'd see all of that magic. He has a lot of stories, but he has a lot of data to support it. And you read these anecdotes, and you're like, okay, that's an exception. It's not one of those results not typical. It's real. And I started seeing it in my patients, and then I saw that thing happen in me. And I actually started calling them fur maniacs. But slowly, one by one, they started falling off the wagon, and because it's just too intense. It's real. It's powerful if you can stick to it. But it has basically in a nutshell, partially pun intended, he has something called a G-bombs diet. And it's greens, beans, onions, mushrooms, berries, and seeds. And he has recipes, and he has a website. He's actually quite the marketer, which makes me kind of pull back a little bit, but it's real. And so it's just that you got to have that, where's that magical intersection between what works for weight loss and health and stuff, and then what's livable.
Yeah.
And that's the Holy Grail. And I believe that, of course I do, that my nutrition star is that. And I've seen it work in people. I've done the research and studies and stuff. It's going to be tainted anyway, because it's me doing the research, right?
Sure.
So I'm not going to pay somebody to do it. It's just, I believe in it. And most people who do it, it works for them. So, but again, it's still hard. And so that's why I'm working on my restaurant. That was a nice little segue.
Oh,
it's hard.
Yeah.
It's simply hard. And so until we make it easier for people, then it's not going to be sustainable.
Well, before we get to the restaurant, I do want to, because we didn't close off the prostate cancer stuff. So what happened? So you did this diet. You show up there. You're at like a 105 blood pressure. Like what's, is it the diet alone that led to the remission?
Yeah. So, here's confession time. I've always gotten my exercise from sports. And then when I blew out my knee at age 30, and then I used to play a ton of volleyball, and I tore my rotator cuff during a roundhouse spike, and I just kind of pulled the rug out from under me. And so I went and got these repaired. But because the original right knee surgery that I had was only a scope, they were going to repair the whole thing, but they went in and found out that the ACL, the anterior cruciate ligament, was only partially torn. So they made an intraoperative decision just to kind of leave it there, and didn't give me enough advice about how critical it was to strengthen my quads and rehabilitate. I did some, and enough to get through and pain and back to full function. But over time, because I had a slightly loose ligament or a weak ligament, then slowly over time, my knee joint just ground down to nothing. And so I'm bone on bone. So my orthopedic surgeon just says, you're banned from all running, jumping, and cutting. And I'm like, just take me out back and shoot me. I don't enjoy swimming. I think I got better things to do. I think if I had my own pool and didn't have to have people see me, my scrawniness, that I'd probably go more. Bicycling, I've never been a cyclist. I finally got myself a mountain bike, but in Flower Mound, I haven't even been out to the lake to explore the trails. It's just so busy with other things. I, just like any human, have excuses, etc. But it's hard for me to make time for the kind of exercise that I enjoy. So all of that was diet. All of that improvement, 100% was diet. Occasionally I went out for a walk and stuff, but it was all diet. And here's another phenomenal thing. And again, you're going to get all kinds of blowback, or you may, or I might, whatever. I didn't restrict salt at all. And everybody says, okay, well, the DASH diet, from the American College of Cardiology or Heart Association, etc., limits salt to blank. Well, another pioneer in the field of what I call the new nutrition, John McDougall, and you can see that on my nutrition site is there's a little thing that says salt at the top.
The nutrition star?
Yeah, if you go down, you can click a little link that says salt. And Dr. McDougall, there's a link there.
Okay.
And it really is not the grand evil. I don't know. Yeah. So it's not the salt. It's what you eat the salt with. It's the French fries, not the salt on the French fries, that's making your blood pressure go up. And so because I was eating healthier, I probably ate more salt and still I had that incredible blood pressure. So my general opinion is salt, you don't cut it back too much, but you don't do excess. So just moderation in salt. So
let's see what it says here. So he's quoting the British Medical Journal in 2002. Lowering sodium intake may have adverse effects on vascular endothelium through stimulation of the renin-angiotensin system and on serum total and low-density lipoprotein cholesterol concentrations. Can you translate all that into English?
Yeah,
I can read it, but I don't know what vascular endothelium is and some of those other ones.
Yeah, so the vascular endothelium is just the inner layer of the blood vessels. Okay. And that has a lot of attention in the world of medicine because that's what kind of is damaged that begins the whole process of heart disease buildup. The renin-angiotensin system is part of the kidney system of controlling blood pressure. And of course, LDL cholesterol is the bad cholesterol, we call it. So apparently in this study, and again, you can't just go by one study. You got to look at it. I mean, how many people were involved? What kind of, bias might there be and stuff? So that's his, justification, but you have to look at it and go in deeper and heavier. But just what I've seen and what I've learned, and, there's Scientific American, I think, put out a pretty damning discussion or article about how we shouldn't vilify salt. Damning is in like the medical community that's telling us we need to freak out about salt. So there's more out there than just this. And then I think above that, he talks about somewhere in there, he says, so maybe don't cook with salt, but don't, when you taste salt, it's on the outside of the food. And so, maybe cook your vegetables with less salt and then just add the salt after the fact. And then, you're getting all the flavor without potential damage. So anyway.
So if I can take it, if you don't mind me addressing it, in somewhat, I've heard it's like a racial issue that you hear black people, they can't eat salt because they have certain health issues. What can we talk towards that? Like, how does that? Is there an ethnicity bias with salt, like people having high blood pressure due to salt based on their genetic code? Like, how does that work?
And so you'll see about halfway through the paragraph, it says, if you are salt sensitive and you're at high risk because of certain things. And yes, there's no question that African Americans have a higher risk in certain ethnic groups. Salt does, they need to be worried more than others. And
so that is confirmed. That is scientifically sound.
I believe so. Yeah. So
interesting.
So you still have to be concerned if you're going to be salt sensitive. But as I say here, it's my very strong opinion that what you put the salt on is far more important than whether or not you salt. You use salt.
Is that? I'm thinking back to like 30,000 years ago, 50,000 years ago, maybe even less than that. Maybe even after the what is that? The deep freeze 12,000 years ago, the Ice Age. I couldn't remember the name of it, but maybe even since then, that would be probably better example. Something like 10,000 years ago, you've got people in Europe, you've got people in Africa and Asia, and they're eating a specific kind of diet. And is that related to why now you have tolerances and intolerances to certain minerals and food content?
I can't say that I know, to be honest with you. I would assume that so much of it has to do with the way our body has adapted over time and, genetics and stuff like that. But I'd be lying if I indicated that I had any kind of expertise to answer that question.
Okay. Yeah. If you have anything, just wave your hand at me, John. But I'm thinking about it because, like, Northern Europeans, there's a lot of, like, salted meats, preserved meats, because it's cold and it's winter, and we've got to do something to keep our meat, and we don't have refrigeration. So what do? We salt the hell out of our pork and our beef and everything else, and that preserves it.
Yeah.
So I'm thinking maybe, I'm just spitballing here.
I think it's a great hypothesis.
Yeah. I mean, I'm thinking that if you're living in the plains somewhere in sub-Saharan Africa, and you're doing a lot of running, and you're eating things off the land, and you're actively hunting, there's not really a need for preservation of food, so you're not eating salt, and so you don't have a tolerance for it. That's why you have the different proteins that people can handle lactose from the dairy in Europe, but then they come over here and drink the dairy here, and they're messes up their gut, have different reactions. Yeah. So anyway, we're not necessarily proving anything here, but it's a thought as to why.
Interesting for sure.
Yeah.
Yeah.
So I'll diet. I'm kind of blown away by this because my grandfather died from prostate cancer, and I watched him die. I mean, I was there, and they wheel him into the hospice, and I mean, I guess I didn't know because I was younger. They didn't really tell me how bad it was until it was at the end. Yeah. But I remember the guy drank all the time, had the biggest beer belly you could imagine, and it's all bloating, right? A lot of inflammation that you wouldn't believe, and so, you know, us Wagners, we're pretty lean people. We're, you know, high metabolism. We're pretty healthy in general, good genetics. Awesome. I would argue. We got a good deal, but but yeah, he just wrecked his body, drinking, smoking cigars, just eating whatever, just living large. And you know, some could argue that, hey, he enjoyed his life, and that's great. But you know, his life ended early because of prostate cancer, and it's cool to meet somebody that just through diet.
Well, so I need to finish the story then.
Yeah, please.
Because I need to make a very frank statement that's going to go exactly the opposite of where you thought it was going to go. Okay.
Okay.
And maybe this is good because I need some kind of a forum to be able to get this word out because it was such a fascinating journey for me, and I learned so much from it. Again, you're talking about a study of one, but when I tell you about this, you'll agree that I've, you know, learned some things that are really critical to understand. So first of all, the studies that suggested that you might be able to reverse prostate cancer were misread, were misinterpreted.
What did they say originally?
Okay, so and I think it's appropriate to say this, but there was a study that was conducted by two of the pioneers in nutrition, Dean Ornish and Neil Barnard. Dean Ornish, just you can look him up. He has the Spectrum is the name of his program. But from what I understand, he's the only, at least he used to be the only author or creator of a program a lifestyle medicine program that was so well proven that Medicare covers it. And it's a very expensive program. In reversing disease and diabetes and even heart disease. Okay. And so, you know, he's the real deal. I mean, compared to him, I'm a little tiny, you know, grain of salt. I mean, he's just done so much in his life. And so, and I'm going to look at that right there, and I apologize. I have to call him on that, and I think it's okay to talk about this because it's the right thing to do.
I'll describe for the listeners. So we're looking at the Ornish Reversal Program and what it can do. It says it can reverse heart disease, reverse diabetes, reverse prostate cancer, and help you lose weight.
Yeah, 3 out of 4. Okay, so I'm probably just going to have to leave it to your discretion as to whether or not you want to include this, but this is really critical to understand. Yeah. So any physician who knows anything about prostate disease and prostate cancer knows that the majority of elevated PSAs, so the PSA is prostate-specific antigen, it's specific to the prostate, so if it goes up, then you have something wrong with your prostate. And so everybody knows that, or should know, that elevated PSAs, the majority, and probably around 3/4, are not due to prostate cancer, but due to inflammation. Well, up until my experience, I interpreted that as infection or enlarged prostate. And I had enlarged prostate symptoms from age 35. And so, and then I had 2 second-degree relatives who had died in their 50s from prostate cancer. So I was really keeping a close eye on mine.
Yeah.
They were more naturalists. They didn't see doctors and stuff, so they just kind of let it run its course. But I was keeping a close eye on mine. And so I went to I had a PSA of about a 2.7. And PSA normal values are between 0.4 and 4.0. Okay. But the older you are, the higher you should be able to accept it because your prostate grows slowly over time. So if you have
no matter what,
yeah.
Oh, wow.
So
okay.
And then it's so common that I think the statistics are that 1 out of every 3 men above age 65 have prostate cancer and don't know it. 2 out of every 3 over age 85 have it.
Wow.
But it's such a slow-growing cancer. There are aggressive strains, but most of them are so slow-growing that you'll die with it, not from it. And so you really ought to stop checking for prostate cancer somewhere around 70 or so. And it depends on the individual. If the person got heart failure and you expect them to live 3 more years, you have no business checking a PSA. Just have no business. And, I saw this thing that Warren Buffett got his checked at 80, and I'm like, give me that doctor's phone number. I need to give him a little, I'm thinking Spanish, arrastrado or something, just, smack him upside the head.
Yeah.
Probably even said that wrong. Anyway, so if you have a 30-year-old with a 3.7, you have prostate cancer until proven otherwise, unless you have an infection, and I'll explain something in a second. That was the big aha moment for me. On the flip side, if you're 62 and you have a PSA of 0.9, you are never going to die of prostate cancer. You can just stop checking.
Okay.
So they really ought to have normal values like per decade of age.
Right.
Just so, because you don't get, confused by all that. So here I am at age 50, and my PSA, I check it yearly, and there's all kinds of argument about how often and stuff. And of course, my way is the right way. But I was about a 2.7, and then age 50, it jumped to a 4.3.
Ooh.
And I went, oh, garbage. My partner, who was also my PCP, Dr. Haveman, James Haveman, he said, okay, let's add a free PSA, and it's just an additional test that you can add that gives you more information, and there's a table that has percentiles. If the lower the free PSA, the higher the risk for it being due to prostate cancer, and it was low. And so I went to my urologist, Dr. Keith Wagasback, and he said, yeah, let's do a biopsy. And he was very kind. He did a baker's dozen. Usually you do 12. He gave me that extra 13th. Oh, yeah, way to go. Thank you. Just trying to be thorough. And sure enough, prostate cancer.
Wait, hold on. What's the 12th and 13th? The finger? Is that what we're talking about?
No, the biopsy. So
got it.
Transrectal, you go in, chunk, this is going to feel like a rubber band, and ooh, mighty powerful rubber band.
Okay.
So anyway, but you have prostate cancer. And, he said, all right, I want you to read this book. And it's the Bible, Patrick Walsh, All Things Prostate Cancer. And Patrick Walsh is the father of the minimally invasive robotic-assisted nerve-sparing radical prostatectomy. It's a mouthful.
Wow, no kidding. I'm amazed that you even remember that. Is this okay? This is it.
That's it.
Dr. Patrick Walsh's Guide to Surviving Prostate Cancer. So this is what you were recommended to read.
Yep, big old Bible, big old beast. Lots of pages there, and I didn't read every single page, but I read through it, and I knew stuff as a physician, certain options of addressing prostate cancer. But there are 7. You can heat it, you can freeze it, you can do chemo, radiation, you can do hormonal. I don't know what number I'm on. You can cut it out, and then you can have this option called the surveillance option. And because prostate cancer is so slow growing, you can just watch it. And most people are like, wait, what? I got cancer. Do something, right?
Right.
But it's a real option. In fact, there's a lot of data to support that, you don't want to do more harm than good. You're dealing with a pretty sensitive area in there. Erectile function, incontinence, or continence, etc.
Right.
And so, I read this book and kind of, learned more about each of the options and stuff. I go back for my follow-up, and he says, all right, well, you know what the options are, and what are you thinking? And I said with great confidence, the surveillance option. And he said, oh, okay, that's fine, but what made you choose that? And by the way, there are grades, of course, and mine was something called a Gleason 6 out of 10, and it was a perfectly good option for that level. But because very few people choose that option, he was kind of a little surprised and said, what makes you choose that? And I, with confidence, said, I'm going to reverse it through diet.
Wow.
And he leaned in and he said, Doug, he said, this is cancer. This is uncontrolled growth. You may improve your quality of life. You may slow it down a little bit, but it does not go backwards. And, I don't know what my face showed, but inside I popped those little peacock feathers out and said, you watch me. So, I mean,
Wow.
I went hard and heavy, and I did. The surveillance arm essentially is every 3 months, you recheck the PSA and a rectal exam. Thank heavens I never have to do that again. And then in a year, you repeat the biopsy. And so 3 months in, again, I talked about my blood pressure thing, but my PSA, sorry, I do this all the time. I got to back up. So Dr. Ornish and Dr. Barnard, their study, this is the one that I learned about shortly before my diagnosis, they were able to compare this people, a large, pretty decent size number of people that followed the SAD diet, the standard American diet, versus a whole foods, plant-based diet.
Right.
And over 6 months, the SAD diet went up by an average of 0.5, and then the whole foods plant-based went down by 0.5 for a delta of 1. And again, when you're dealing with a 0.4 to 4.0, that's a pretty big jump or difference.
Yeah.
And so then they were like, oh my gosh, we might be able to reverse prostate cancer. They repeated the study, got the same results, and this is what they presented at this conference. So this is what I had in the brain. And I said, I'm going to reverse this. I'm motivated. And he was like, you're okay to follow this surveillance arm. What you do is, your decision, but let's see you back in 3 months. My PSA went down by 1.6.
Whoa.
None of this 0.5 garbage. When you do a dietary study, it's a lot of fishiness, people reporting things and whatever. And those whole foods, plant-based aficionados who disagree with fish, I had a lot of fatty seafood during that time. And so I believe that it causes more benefit than harm. And so even with that and all the plants that I ate, a 1.6 drop. And then the next one was down, so 2.7, and then the next one was 2.6. It stayed 2.6, 2.7 that entire year. So I went back to Dr. Wagasback, and I'm walking in going, I got to see what you have to say about this.
Shaking your peacock feathers a little.
And he said, oh, that's interesting. And I'm like, and he's a great guy. I mean, I still refer all my urology patients, to him. But I was kind of like, come on.
Give me the
you gotta
satisfaction.
admit that there's something going on. But he knows and knew more than I did at the time that the PSA can fluctuate. But when it stayed that level the whole year, I'm excited. And so what I tell people is that never before has a man looked more forward to a prostate biopsy than I did.
Yeah.
And never before has a man been more disappointed. When my Gleason score went up to a 7, it actually almost exploded. So if I remember correctly,
wow,
my the initial 13 biopsies, 3 of them were positive. But of the cells within the biopsy, there were only about 20 to 30% involvement, and there's fudge in there. I know that I'm missing some numbers, but in the second biopsy, I had 7 were positive, and a few of them were more than 50%. So I call that exploded.
Yeah.
So despite all of that, with the PSA staying there, it was not indicative of prostate cancer, and that's when I went, oh my gosh, it's because I reversed inflammation. And we know that inflammation, but people blame it on infection. Your diet totally can affect your PSA. So I went, holy cow, they're misinterpreting the data. That's why their PSAs are going down, because of inflammation, not because of reversing prostate cancer.
Wow.
So I go back to the same conference that following year with the sole purpose of cornering these two physicians, which I did. And, you know, they're very, popular or whatever. Dr. Ornish, that second year that I went, won the first Lifetime Lifestyle Medicine Award. And so he got swarmed by everybody afterwards. So I kind of stood in back and waited, had written my story on the back of my business card. And I waited like 30, 45 minutes. And finally, the last person just kept going on. And he finally kind of looked at me and he said, just a second, can I help you? And I said, yeah, sorry, I don't want to interrupt, but I'm Doug Cluff. I'm a family physician. And I just wanted to tell you, I've got my little story written on the back, but I think you're misinterpreting the data as being reducing the PSA due to inflammation, not because of prostate cancer. And I don't remember exactly what I said, but I said enough that he understood, and he went, oh. He said, have you talked to Neil about it? And I said, no, not yet. I was going to corner him tomorrow. And he said, we will call you. And so the next day, went to one of Dr. Barnard's, Bernard Barnard, I think it is, lectures, went up the escalator, said, hey, Dr. Barnard, I'm Doug Cluff and blah, blah, blah. Oh, have you talked to Dean about this? And I said, yes, we will call you.
Huh.
No phone calls.
Oh, really?
And I don't believe that they're full of it, but I'm a little worried that he still has that on his website, that it says you may reverse prostate cancer with that, because that's a study of one.
That's interesting.
Pretty powerful, though. I don't believe that that's true. So Dr. McDougall has quoted that study, and he has kind of redefined how he defines treating cancer is that if you can live a normal lifespan, then you have beaten it. So with his starch solution, by the way, you want to kind of get an eyeful. 70% of the world's population lives primarily on starches and beans and corn and potatoes, and they're the healthiest populations on the planet. I know they're very powerful, but again, you can find criticisms. There's a book called The Blue Zones, and they've just picked several places throughout the world where they have people that just live a long, healthy life. And Dr. Dan Buettner, who's not a physician but a fellow of the National Geographic Foundation, they funded him going into all of these places, the Nicoya Peninsula in Costa Rica, Sardinia, Greece, Okinawa, Japan, and even Loma Linda, California, where there are a bunch of vegetarians. And he's put this into a book. It's really a good read.
See if there's a picture, there's a map. I've seen this before. I've heard of the Blue Zone. Pull up that map, John. That's amazing, though, that if PSA levels are affected by diet because inflammation is being reduced, then our doctors, let me understand if I'm hearing you correctly, are doctors misinterpreting what PSA levels mean?
In that instance, yeah.
So they're misinterpreting, they're misdiagnosing prostate cancer as being just
they're
middle-aged inflammation?
No, I don't think it goes that way as much as that if they're thinking that they're reversing prostate cancer because they're seeing the PSA go down, they're misinformed or misinterpreting.
I see.
So, Dr. McDougall quoted that study recently, and I'm just like, okay, I've got on my list of things to do. I've somehow got to get a hold of these guys and say, hey, guys, don't you remember our discussion? And anyway, so again, that's a study of one. So if they've taken that information into consideration and proven on biopsy that they've been able to do it, well, then I'm an outlier.
Sure.
And I'm willing to accept that. I'm again, anxious to find the truth, but I haven't seen that yet. So
it'd be interesting to see what the outcome of a conversation would be with you sharing your data. And then let's get back to that map. I wanted to still stay there. I didn't mean for you to close it, but it'd be cool for you to see you compare your data with theirs and see if you are an outlier or if there's something to be learned there. Yeah. So you're talking about these blue zones. These are people that eat high starch diets.
Well, so mostly I think it's different from that quote that I said about 70% of the world's population, but it does apply mostly to them. But mainly his point is that it's a mostly plant-based, whole plant-based. And I totally messed up. I do this. Sardinia, Italy, Icaria, Greece. I think I may have said Sardinia, Greece or something.
Oh, okay. Zoom in on that, John, if we can. I just want to, my eyes are shot at the end of the day. So we're looking at it. It's interesting how there's a kind of a horizontal band, right? You don't see anything north or south of these locations. Like you don't have anything in Canada or Europe, Russia, Africa, or South America, Australia. Is there anything to that? Like this is just what grows in those areas?
I noticed that, but that is interesting.
It's not. It's all north of the equator.
Yeah.
But it seems to be in a specific temperature region of the
latitude. Yeah.
Mm-hmm.
Well, and they found a sixth blue zone, and I think you wrote another book after that about that. I can't even remember where that was. I don't even know if I bought the book, but he's, again, Dan Buettner, he is a million miles ahead of anything that I wish I could accomplish. But there's been a little bit of, I think Fort Worth became blue zone certified, and I started looking into that and what that entailed, and it seemed like it kind of got off the purity of the mission and stuff. But anyway, it's very fascinating.
I'm sorry, but that's all BS. There's no way anything in Texas is a blue zone.
Right?
I don't even believe that for Austin, man. I mean, Texas is franchise capital of the world. Let's get all the franchise restaurants here.
And I don't think it's suggesting that they're following it, but it's like certain criteria were met to kind of encourage a healthier move towards.
Now they're going to do a blue zone star rating. This meets 5 stars out of 10 blue zone.
Well, and I wish they would do something like that. I've got my, again, plans to try to influence the world. I always tell people that I've got all these, wonderful ideas, and I'm right on the cusp of making them all go, but I'm missing 4 things: money, people, time, and expertise. That's all. Just those 4 things.
That's all you need.
Right on the cusp.
Yeah, I just need a little bit of that.
It's just me, so anyway.
I want to put a bow on this, on the prostate cancer thing. So diet did or did not actually lead to the curing of the situation?
It did not. Okay. It did not. So at that point, I said, cut that sucker out. So I had a full nerve sparing, thank heaven, so I didn't get the side effects. And it was done by Dr. Wagaspak, who had done hundreds and hundreds of them before. So was had faith in his outcomes. And so I went through it, and I learned that, and I learned that it didn't reverse it. Now, might it have slowed it down? Possibly, but it definitely didn't reverse it. It definitely got worse. And so I ended up curing it by cutting it out. And luckily, so far, 6, 7, 8 years out, all of my PSAs have been undetectable. So we believe we caught it before it metastasized.
Yeah, well, that's good. I'm happy to hear that. Do you think that any kind of accelerated growth of the cancer was a result of the diet, like introduction of some other substance you were eating?
That's an interesting question. I don't know if there's any way to find out. I have never thought about that as a possibility. The fact that it did everything else really well, all the things that I expected it to do for my cholesterol, for my weight, for my blood pressure. I'd be surprised if that was the case, but there's no way to know.
Yeah, well, it's great that the inflammation reduced so much. I mean, it's just reflected in that your blood pressure was so low. Just all of the other performance things you mentioned improving. Yeah. Like that's a
pleasant surprise.
Yeah, pleasant surprise.
Yeah.
Nobody's going to be disappointed in that.
Yeah.
Oh, that's good.
Except for the women. Yeah. I can't believe I said that. I can't believe
we're leaving that.
Yeah.
Mrs. Cluff, we're leaving that. No.
Yeah. She would just jaw drop and.
Oh no! Everyone will get a laugh out of it.
No, she'd probably she wouldn't be surprised, but she'd be horrified, mortified. But anyway, as would other certain people who used to respect me. Anyway, go ahead.
That's all right. Was the prostate cancer journey and the experience of what you saw, the results of the diet? Is that what led you to do the website? And it seems to me that you're more. Let me elaborate. It seems to me that you and your practice overall are more interested in preventative health, diet,
And lifestyle.
lifestyle.
Yeah.
Yeah. So I've observed that because you have a lot of literature, a lot of collateral that you hand out to patients. I see in your newsletter that you email everyone out. Like, there's a lot of stuff that covers about just health in general. And I know that's vague and maybe obnoxious, but health related to like diet and lifestyle in that regard. So what have you learned since going through the prostate experience up till now in terms of like diet, in terms of preventative care, in terms of like more so beyond just the 5 points on the star? What are some daily things that we can kind of take from that?
Well, and so speaking of stars, so the logo for my practice is a star also, and it is to represent
I don't know if I noticed that.
the 5 therapeutic lifestyle changes that, and so, Dr. Ornish has his 4 things that he promotes, but mine are nutrition, exercise, weight management, stress management, and quality sleep. And so somewhere, I believe it's on the front page, my goal is always to reduce the medicines that people are required to take. I try hard to have people work on treating things with lifestyle before resorting to medicine in most cases. There are definitely some exceptions, but my goal is always either to treat with lifestyle or reduce as much as possible the amount of medicine people have to take for their different medical conditions. And of course, everybody's different in their capabilities or their belief in the system, and genetics play a role, whether or not you might be able to get off of something. But that is one of my greatest, raise the roof, exciting, wonderful successes when I can pull somebody off of medicine because of lifestyle. That to me is the greatest satisfaction in my professional career.
Yeah, that's got to feel amazing.
Yeah,
because you're like, okay, this is working. This is happening. This person's going to live longer.
Yeah, and then what's really important to emphasize for everybody is that it's not all about the numbers. So again, a person with a certain diet may say, hey, look, I dropped my LDL by blank, and it was completely opposite from your diet. So, and I can do it too. And I'm like, okay, you fixed the numbers just like I had fixed my PSA, but it doesn't mean that you're not actually developing heart disease. So cholesterol doesn't kill you. Cholesterol that sticks kills you. And what makes it stick is inflammation. So if you have an inflammatory diet, I don't care what your numbers are. You can be a 40-year-old man who has a cholesterol number that's low and die of a heart attack because you have other inflammatory factors in play, a strong family history or smoking or obesity or diabetes or high blood pressure. All the inflammatory rheumatic diseases and stuff are risk factors for heart disease. Then you can have somebody who their entire life has high LDL cholesterol but never dies of a heart attack because they have a very anti-inflammatory lifestyle. Lower stress, quality sleep, exercise, normal weight, no diabetes, no high blood pressure. So, I don't care if you tell me that with the Atkins diet you dropped your LDL to blank. I don't care. Good for you, but it doesn't mean much to me because I know that it's not just about the numbers.
Doesn't show the whole picture. Yeah, if you're targeting the one thing, like in your case, the PSA number looked better, but it wasn't a representation
It wasn't real. Yeah.
Wow. Okay, so if someone can look at their LDLs and think, oh, I've got a good number, I'm happy, or whatever number they're looking at, that's a single metric.
One piece.
Yeah. What is it would you say that inflammation is a primary indicator of a lot of issues?
Yeah.
I don't know. That's I'm leading the witness here.
And that's a catch word. I mean, it's a popular thing that everybody's using now, but it's very real. There are various markers of inflammation, but the classic markers of inflammation aren't always indicative of the type of inflammation that we're talking about that actually does lead to disease. It's more of do I have an inflammatory condition? So.
What can I do? How would I know if I'm asking the doctor how would I know if I have inflammation versus not? Like, what's something I can do in my day-to-day thing?
Yeah, so I mean, all of the factors that we talked about, blood pressure, obesity, fat cells are inflammatory by nature. So, looking at the entire picture, you can kind of tell like what kind of lifestyle do you have and the family history and stuff. And then what kind of diet do you have? And it's a much, much better indicator of the level of inflammation in your body than a marker. And yet there are many people way smarter than I am that say, no, if you check your high sensitivity CRP, I'm going to blame that on the braces.
It's all right.
But and there are other biomarkers and stuff, the lipoprotein A and things that a lot of people say you need to be checking on a much more regular basis. But they have a lot less science associated or, things to back those up. But again, now I'm starting to get a little bit out of my comfort level as far as acting as if I know what I'm talking about. So I leave a lot of that to the specialists and the researchers.
Sure.
But, so there are some biomarkers that you can check that might give you a better idea and might uncover inflammation that you didn't know you had. But the history and the physical appearance, et cetera, their dietary history are much more indicative, from what I understand, of what kind of inflammation you have in your body.
Okay. So there's no magic secret thing. Like you'll be able to kind of tell just by observing these things that you mentioned.
Yeah.
I remember years ago, because just like yourself, you talked about your book earlier that, the information is not as good as what you have now. It's part of that journey.
Mm-hmm.
I think we're all on this kind of like health journey as a species, as a culture. But years ago, I think I was a little after college, I was at the gym and I overheard these women talking, and this one girl's like, "Girl, I'm eating healthy now." She's like, "Yeah, what are you doing?" Like, I'm drinking Gatorade and eating at Subway. I was like, oh my God. Oh man.
Lots to learn. Yep.
The idea of what is healthy and what isn't. Is because you mentioned that a minute ago. You said, well, eating healthy and knowing your diet. And I think there's like the SAD diet you mentioned, standard American diet. I think people generally think that they're eating healthy and don't know.
Yeah. Yeah. They believe the advertisers, the marketers,
Yeah.
Low fat, healthy. Low carb, healthy.
Dude, the fat thing drives me crazy. The low fat. And you go to restaurants now, and they're even saying egg white omelet. And I'm like, stop that shit. Yeah. That drives me nuts. It really upsets me. I'm like, that's not a thing. We've proven a long time ago, not a long time, but we've proven within a number of years ago that, like, we want all of the egg yolk. Mm-hmm. We want the healthy fat. Yeah. Stop this low fat thing. It's just...
Yeah, it is very, very frustrating, and you just kind of roll your eyes and wish you had a bigger bully pulpit,
Yeah.
So.
Well, it's like people that are large that I know in my life, not large in my life, but they're large people.
Yeah, yeah.
and it's like they're talking about low fat for years and they're still not getting smaller. I'm like, haven't you figured out by now that this isn't going to work?
Yeah.
Sorry, I'm grandstanding a little bit, just venting on some of this, but
can't disagree.
Yeah. So. I'm sure you may experience that with patients, just the same kind of conversations.
Yes, sir. I do, day in and day out.
Well, that's a great segue into you talking about your restaurant. So, because this is great. I mean, I love watching your journey and just kind of observing it, because you've got the practice of going from standard medicine into direct primary care, which I think is an administrative change as well as like a quality of life change for yourself and the patients. Yeah. I think it's a big change there. But just like that nutrition journey of experiencing cancer yourself, of self-healing with a lot of the reduction in inflammation. You've got your website, and you focus a lot on diet and quality of lifestyle for your patients. So that's not enough for you, huh? You got to start a restaurant.
Yeah, just looking for the best way to help.
Yeah. So what is this? It's health food restaurant, I assume?
Yeah. So, I'll say something that's kind of a blanket, pretty bold statement, but, I've done a lot of different things with the attempt to help the health of the nation and give people tools. I have this very lightly touched upon nonprofit called Keep Flower Mound Healthy, a national nonprofit called Project Simplify Health. And you can see websites, but just I haven't had time to do things. But Keep Flower Mound Healthy was meant to try to help people identify restaurants, the different menu items that were healthier than others.
Oh, that's cool.
Excuse me.
Yeah.
And again, we didn't get very far into it. Project Simplify Health was meant to identify supermarket products that, the goal was to eventually have a little logo on the items that met certain criteria, so you wouldn't have to stop and look at the label or even wonder, just look for the logo and pop it in your basket and off you go.
Is Keep Flower Mound Healthy, is it online? We can look at it?
Yeah.
Let's pull this up, because this is a really intriguing idea that you
KFMH.org.
KFMH.org.
Yeah.
Keep Flower Mound Healthy. So this is just about Flower Mound, Texas. But
right.
I love the idea that I can look at a list of my local restaurants.
That's promising.
Yeah.
So,
Site certificate.
Yeah.
Keep Flower Mound Healthy. Let's pull that up, John. And what I love about this idea is that I can see local restaurants that have cool menu items. So where do we go on here?
So Route 66 is the link that would kind of start to show you some of that stuff. But and then right there is you click on that to see the database. But it's very limited, again, just because I download the route. No, that's not it. That's just the calling all restaurants to help. So it's right there. So
here we go. Okay.
There are a very limited number of restaurants, but we've kind of scoured the menus and tried to come up with the healthiest things that meet certain criteria. And the group of us that contributed tried to decide on a 2 to 2/3 rule instead of a 4 to 1. Yeah, it's, like I said, very limited. And I got a good group of people who are waiting for me to kind of take lead on that. If you push the About Us, you'll see I've got a dietitian that's working with me. Jesse James Nancy Moses is the dietitian, and Jesse James, probably heard of him. He's pretty popular in Flower Mound. And I do need to give a little shout out to Naomi Sweet, who's my niece, who actually designed the logo and also designed the nutrition star. Prior to that, it was this doctor-created wannabe graphic.
Is that her avatar, I guess?
Yeah, and she did those for me, so
Naomi
she does
Sweet,
great work.
Yeah. No, you've got a good, well-branded website, and the way it looks. So, and she made this logo too, the Keep Flower Mound. Okay,
she did.
It looks good.
So.
Well, I like that. Can you go back to that list, John? We're looking at the Route 66. What is it? Just towards the bottom? Is that where it is? Or
well, it's clicking on that
database.
link there,
okay.
Yeah. It's a different page.
Yeah. So even just as a start, as a beginner, just to see a beginning list, just to see hey, here's a handful of restaurants that are franchises in my area. Here's some. And you said it's a 2/3 versus 4 to 1. So what's the difference there? So
it's basically 66%, being made of whole plants or fatty seafood, essentially.
Okay.
And it's hard to, it's sometimes hard to find the information about each. And so we have to kind of estimate sometimes. But the goal was, and so I have this national, I don't know if you want to segue into that, but it's called Project Simplify Health. And I think it's gopsh.org. If I've got my nephew is actually the guy who's hosting that, so hopefully that's up and running. Jeffrey Angel.
And what is this one?
Arg.
You can hit advanced and then proceed. Yeah. It's a site certificate. They just need to renew that.
Yeah. So this is basically, and then the pictures aren't showing up, but essentially it's trying to go into the products on the shelves, and the hope was to have this be a national thing where the makers of different products, we can have all of their stuff, but then each individual town or city would be an affiliate, and that they would work on the the specific restaurants in their area, and to develop a database so people go on the app and they say, I'm hungry, but I want to go somewhere where it's somewhat healthy, and look, I can go to this website, and bam. and then feed those people business so that it encourages people to improve the health of their menu items.
Well, I love this because
So,
you're kind of creating an ecosystem of like,
helping.
you got it all within your practice. You've got the nutritional information coming from the doctor. You've got your nutritionist on staff. The nutrition star just tells you about how to eat, what to eat, and then the web keep Flower Mound healthy I would call that even like a pilot, because that can expand to tons of cities and stuff. And,
Yeah.
and now you get a database of like restaurants that have great healthy items.
Yeah.
And then now grocery store items, and then that takes us to you making a restaurant, man. Let's hear about this.
So part of the reason I wanted to kind of take you through that journey is that you can see that I've tried various initiatives.
Yeah.
And what I feel very strongly is that all of those put together, including my, goal of trying to get my practice model expanded and stuff, pale in comparison to the good that a restaurant franchise could do, just because it simplifies it. And so, the restaurant is called WHOLi KaBOWLi.
Okay.
And so if you go to, it's actually WHOLi KaBOWLi. Holy, it's all one word. You could probably, but you can.
So
KAB.
Yeah, KABOWLi.com. And so, Carrie Mitchell is the one who designed that. No, I'm sorry. Carrie Mitchell designed my Slim TLC. It's another thing that you can look up too, but there you are.
SlimTLC.com. There's my partner, Sean. He's the restaurant guy, because of course I'm not a restaurant guy.
Yeah.
And if you scroll down, there's my executive chef, Matt Becker, and Marie Barber.
I know Marie, yeah.
Is my...
she's the nutritionist, right?
Yeah, my nutrition coach.
Or coach, sorry.
But she's also a chef, and she's kind of helping with the food truck part of things. We're hoping to do a brick and mortar, but just for funding and for proof of concept, we may end up having to do a food truck. But we're going to be launching a Kickstarter campaign here in the next couple of weeks to try to raise funds for the food truck.
That's great.
But if I just happen to get enough money for the brick and mortar, we'll skip right over that and go into the restaurant. But
yeah. What's the concept?
So the concept is, it doesn't even have a whatever section except for add-ons. Okay, so the whole base menu is 100% whole plant and fatty seafood, with some minor exceptions of some very low calorie things like soy sauce or something that you can't call, you can't call that non-processed, right?
Right.
But the goal is that the more you eat there, the healthier you will become, and that it doesn't matter what you choose on the menu, that you will get healthier. And then you can have add-on proteins after the fact. So, and we'll probably even provide like light sour cream packets or something for those who desire. But otherwise, there's no dairy and no sugar, no oil, no white flour. So oil is another major point. Again, this is not my original, but there's not a gram of oil. Again, that's part of that plant waste.
Yeah.
No oil, no sugar, no flour. So oil has no water, has no fiber, and has essentially no significant micronutrients. Well, what if it comes from avocado or coconut?
I was just going to ask you about avocado oil.
Oil is oil is oil.
Oh,
it's 9
man.
calories per gram.
I love
and
avocado oil, man.
And it's not that you can't have it again, but it goes into the whatever section.
Yeah.
Because it's not a health food. Oil of any type is nature's most efficient way to store fuel. And so good fats with the whole plant, so the whole avocado, the whole olive, that's what you want to get, and not just the oil that's extracting this fat producing stuff and calorie producing stuff. So anyway, so no oil, sugar, white flour, again, what I call plant waste. It's right there in that second paragraph, or dairy. And those two things, I believe very strongly, and again, I could probably extract studies. I haven't done my own, but together, those are by far the greatest sources of hidden calories and inflammation in our diets.
Wow.
So you get rid of those and only health ensues. And so, it's basically taking things that we all love and just making some chefs, and we sweeten things with whole plants, whether it be medjool dates, or ripe bananas or something. I took a recipe that I stole and then tweaked it a little bit for banana nut bread, and substituted whole wheat flour for white flour, applesauce for oil. It still has an egg, and it still has I put some Splenda brown sugar in there, and but it's way above 80% whole plants, and it's just to die for. Again, I can't keep my kids away. I'm like, I worked hard on this. Leave it alone. It's mine.
Yeah.
But if I'm suddenly helping my kids be healthy, oh no, right? But if we can make it simple. And so this is an important little thing. So in 2010, I went to a conference, just a general family medicine review conference. And there was a speaker who was supposedly world-renowned. I'd never heard of him. And halfway through his keynote address, he was the keynote speaker. And halfway through his keynote address, he stopped and he said, I'm not a fan of counseling patients. And I'm like, kind of starting to seethe inside. He had this perfectly timed pause. And I'm like, my whole career, I've been trying to figure out how best to counsel patients. It's kind of like the main thing that I need to do to help them change. And he said, after he paused, he said, we simply need to make it easier. And I went, oh, dang, that is so, so true. It is just simply harder than I'll get out to be healthy. And so I just kind of kept that in the back of my mind. And then somewhere around 8 years ago, I walk into and we do have, my wife has a master's in accounting, and she worked for Price Waterhouse first few years of our marriage, but decided to stay home with the kids. We have 6 children. And so we have kind of that traditional arrangement. But I walked in the door and immediately was hit with this aroma of something really, really tasty, and my mouth starts watering. And I go into the kitchen, and it seems like every dish that we have is out on the counter. And my kids are like army ants, just kind of like doing something. And I quickly figured out that they were doing these rice bowls. And she does really well. She tries to provide healthier options, and then some less, maybe just for variety. And had some 20 some odd ingredients, anywhere from coconut flakes to olives to almond slivers to multiple types of vegetables and mandarin oranges, etc. And I just could not wait to eat. And we sat down, and I got a bowl, and I started putting this, the brown rice in there, and started adding stuff. And I was trying not to be like overly excited, like this is not typical for you. So, but this is wonderful. Thank you. And I quickly figured out that bowl was too small. So I just got up without saying anything. Kids were like, what the heck is he doing? And went and got a big bowl and just
salad bowl.
had one of the most amazing culinary experiences of my life, and it was healthy.
Wow.
And I sat there, and this is the way my brain works. And, so I say, Sandy, you're the reason why I'm doing this. She said, you do not blame this on me, because she likes me to stay focused and important stuff and not get distracted by, the squirrel, different things. And, but I couldn't not. I just said, okay, I'm going to go, we need to start a restaurant. So I immediately, and this is what I do, is I run to the internet and I say, okay, what domain name is taken, what trademark is taken, what can mean rice bowl? And I ended up coming up with rice basin. And that was going to be the original idea for the restaurant. And just have people come in, and you can just build your own. And so I quickly started to realize that you can also build salads with these things. And it would be nice to have a salad as an option for those who desire. And then I went, oh crud, now it's not just a rice bowl. So I came up with this kind of weird logo that had half salad basin and half rice basin. And then the juices kept flowing, and I'm just like, okay, I keep thinking of other things I want to add to the menu. And then I thought, whole basin, kind of a double meaning. It's like a lot of different things. And so I get excited, and, the kid comes out, and I share it with my family one Friday night. And my younger brother, Jonathan, who's kind of entrepreneurial too, he writes back and he says, whole basin, yawn. Surely you can come up with something that's a little bit more exciting. And I'm like, all deflated and kind of like, okay, back to the drawing board.
So glad he made that comment though, right?
Yeah, totally.
We need those people.
Yeah. And so I'm sitting there, he says, why don't you go with something like WHOLi KaBOWLi or WHOLi guacamole? And I'm like, okay, trying to think of things that apply. WHOLi cannoli, that's not healthy,
Yeah.
And
Leave the gun, take the cannoli.
Yeah, exactly. And so I kind of was sitting there, and then I went, the last name of that speaker, Dr. KaBOWLi, now spelled KaBOWLi. And I went, wait, can you do that? And you can, but I'm always worried about, intellectual property and stepping on people's toes and people coming back and saying, I need half your company. But I'm like, KaBOWLi, wow, that's got a great ring to it. And then my daughter Kylie was walking by and she says, look, put your W in there and there's your bowl. And I'm like,
nice.
The clouds part, angels sing, and I'm like, oh my gosh, that has a great ring to it. So that's how the name came about, and it literally is fulfilling what he preached, is we've got to make it simple. So, you're hungry and you don't know where to eat and you want to eat healthy and you know exactly where to go. Now, it's okay if Chili's comes along and says, hey, can I make a WHOLi KaBOWLi section? Sure. Yeah. Bring it. Let's expand. Let's, whatever makes it easier for people. And obviously I can't contain everything on my menu. But if you go onto the WHOLi KaBOWLi page, you'll see that I have different sections of different things on the menu that I would, so we'll have a shrimp and crab kaboil, gumbo salmon salad. That's the food truck, but that will also be, in the restaurant. But then we have grain bowls, salads, soups, spuds, again, and I want to have an offshoot of the spuds one day. I've got the domain name for something called Spud Toppers, and it'd be lovely if you had a line of 6 or 7 different toppings that go well on a spud that has the right flavor, the right moisture, so that it's not dry. And you pull it off the shelf, you pop it in the microwave for a minute, and you dump it on a potato and just go to town, and it's 100% healthy. So that's kind of the concept, and I just need to get the money, got the people in place, got the knowledge because of those people, and just need to get the funding now, and hopefully we can build something that's franchisable. I'm going to share a couple of things that just kind of are probably important and really excite me.
Sure, please do.
So when I first had the idea, I hired a company that actually found an executive chef through an elderly couple that were patients of mine. Well, my sons, I talk about these things. I wasn't supposed to because I was in an employed position, but it'd come up. Oh, I wish I had my restaurant going. They're like, what are you talking about? Well, here's my concept, and you're looking for an executive chef. Our son's an executive chef, and just so happens that he also had a partner that they did restaurant consulting, and so I went ahead and bought their package and said, hey, help me design this restaurant. And the chef didn't work out. Matt Becker's like the 5th chef and won't go into why, but it just didn't work out. But Ray Camillo with Blue, he's going to kill me, Blue Orbit, orbiting.com, I think, restaurant consulting. We were about 8 or 10 months into this, and I get this email from him, and he says, hey, I've never done this before, but never propositioned a client to go into business, but he said, I have never seen a restaurant concept that has more legs on it than yours does.
That's great.
And I'm like, oh, sweet.
Yeah.
And so we hadn't even finished the business plan. And so I suggested, hey, before we jump into being partners, don't you think we ought to, consider this? But he also, he said, because I'm going to be doing he said, why don't you just sit back and collect a paycheck and I'll do all the work for you. But since I'm doing all the work, I need 51% of the company.
Ooh. And
I'm like, watched too many episodes of Shark Tank to know that you don't do that. Anyway, so we just didn't meet eye to eye. So I credit him for the logo. So it was his company that made my WHOLi KaBOWLi logo, helped me originally with my business plan and stuff. Just didn't work out, but I owe a lot to him. So the chef, when we had our first meeting, so Sean, my business partner, and the chef and I met at a restaurant in Irving and said, all right, what do you got? What are you trying to do? In about a half hour, I basically just kind of went through, here's my concept, here's what I'd like to do. And he'd say, well, can you use this? And yes, and well, not that. And, oh, well, what would you use as a substitute? And, oh, but you use salt? Oh, that's awesome. What about lemon juice, vinegar? Yeah, those are low calorie. It's not 100% whole plants, but we're going to make concessions for those. And about a half hour into it, it was just the funnest thing and just got filled with chills. He just stops and he goes, yeah, no, I think this is doable. Yeah, no. And he says, wow, this is going to change everything. And I went, bam, he got it. And so, I know there's something here. I think I've got the right team. Just now need to get the funding.
Yeah.
And then have to execute it correctly. And I have a sweet tooth. I have a drive to eat that's just as hearty as most people's. And so I'm not going to build a restaurant that isn't craveable. And so that's the goal, is that, I've been to many restaurants who, that have incredible foods that say but rarely one that has incredible foods that say they're healthy. Mm-hmm. And usually it's like an exception on the menu.
Yeah.
And I want to just make sure that every single item is just like, wow, oh man, I want to go back because I want to eat this.
Yeah.
That's the goal. So is it a holy grail? I don't know.
Yeah.
But hopefully not.
That's a great idea, man. It sounds awesome. And you can tell the difference when you go to a restaurant that has a quality menu item. You're like, somebody's grandma just made this. Somebody put some thought into it. Yeah. There's a place down the road here on Main Street that has it's an Indian lady that runs it. That's they mostly do catering.
Okay.
But you can order individual dishes, and she makes this this chicken soup in like a kind of a liter, a quart, whatever that container is. Yeah. And it's like $20 for this thing, and you're like, that's a lot of money for a chicken soup. Yeah. Dude, you pour it in there in your bowl, and you just
awesome.
And it's gone, man. Yeah. A whole quart of a homemade chicken soup is gone in like $5 minutes. Gone. Yeah. $20, but it's like worth it. Yeah. So having a dish that just really satisfies, makes you feel good. Yeah. You're glad you spent the money, because something like this is not going to be the cost of a fast food. There's going to be a premium, but I think people, once they taste something that really is enjoyable and they know that how healthy it is, and you have this mission and this vision statement, and they catch that, they're like, it's worth a few extra bucks for me to have this better culinary experience.
Well, and the hope is to keep the cost somewhat affordable.
Sure.
Hopefully not averaging more than $15 to $16 an entree. Mm-hmm. And I recognize that there are going to be communities that aren't going to even be able to afford that. And so eventually the people who need it the most, which are the lower socioeconomic folks, we can pick certain menu items that are the cheapest to make and then keep the cost down for them. Yeah. That's the goal, not to just cater to the people who can afford it. And there are a lot of things out there that you can read how healthy is not necessarily more expensive. Mm-hmm. If you go into a typical Chili's and you just say, hey, I'd like to have 4 plants off of your side menu, you're going to spend a lot less than a meal with a steak or whatever. So, beans and potatoes and, vegetables in general are cheaper. We just have to kind of get that magic combination where we can present it to the public in a very healthy and hearty. It has to be hearty, right? Yeah. None of this, I'm done, but okay, now I got to go to Chili's or to, Chick-fil-A to get something to top it off. It's got to fill you up. Yeah, you mentioned the Chili's thing. It's like, if I don't frequent the place, but if I go, I'll do the best menu items I've found are the ones I've created, like the custom ones. Yeah. So I'll tell them, give me a chicken breast with none of the stuff. Don't put a bunch of extra seasonings or sauces or something. Just give me a nice grilled chicken breast, and then I'll get a few side veggies. Mm-hmm. So the steamed veggies, the broccoli, I don't know, whatever else they got. But I'll just do a few of those things, and then I order enough of a quantity, like 2 chicken breasts, two things. But even
customizing it like that, I'm still spending equal to or less than like a full entree.
Yeah.
It works out better that way.
Yeah.
And I feel better walking out because I gotta say, I gotta say, like places like that, it's like they are over seasoning, they're over saucing, and there's a thing in Texas where they love to drown things in sauce, and it's like, guys, have you ever been anywhere like where they make good food? They don't drown it in sauce.
Yeah.
You gotta taste the actual vegetable. You gotta taste the actual meat. If you drown it in the sauce, I don't even know what I'm eating anymore. I just know I'm eating something that's burning my tongue
and not helping my health.
Yeah.
For sure. Yeah.
Yeah, and at that point, I don't even care about the health.
Yeah.
I just care that it's just like burning my mouth, like from how much sodium is in there, and that's not a fun time. So, Texas, man, let's reduce the amount of ice we put in things.
Right. Yeah.
When we're merging on the highway, let's accelerate to the speed of the highway, and let's not over sauce our foods. Those are my three complaints about Texas. Yeah,
so funny.
Yeah. I'm not from Texas, but
and
supposed to say I got here as soon as I could, right?
And many people say that sauces are what make the dish, but you got to find that happy medium, happy balance.
You do. Yeah.
But what's interesting is that you can make incredibly flavorful, hearty sauces with whole plants. And some people, Dr. McDougall, I think in his book, he talks about how, people say, no, you got to have your meat because you need flavor and stuff. And he says, well, what do you flavor your meat with? Plants, And so the different types of seasonings and herbs and spices and stuff are plants or minerals or something.
That's what I wanted to ask you.
Yeah.
So, talk about that. How do you season with plants? And if I'm not using avocado oil, which everyone says is the healthiest or something, so if I'm not supposed to use oils, how do I keep the thing from burning on the pan?
Yeah. So it depends on who you ask, and you'll see this on my nutrition page that just kind of coming up with alternatives. And, some people say saute in water, and I'm like, no. But what I have done, and I'm okay, and this may freak some people out because they say, well, that's not natural, is those nonstick sprays. I'm actually okay with that. But
isn't that an oil?
It's an oil derivative, but it says 0 calories. Okay. So it's not. I don't think it's unhealthy. Now, I haven't done studies, but if you don't want to fill a pan with like mountains of that stuff, but just a light spray, I use that to help not stick.
Huh. What are those made out of? Isn't that like canola oil or something?
So olive oil. They have different ones.
Okay.
But I use one that is made out of olive oil, but. Just try to come up with different ways to prepare, grill, bake, roast, saute in this way, or different sous vide. I didn't even know what that was until that initial chef said, "Yeah, you can sous vide," and I'm like, "What?"
Seems like a lot of work. I've done it, but
and somebody who knows French, right?
Yeah.
I took 3 years of French in high school, and I'm like, "It's not how you pronounce that. It's not sous vide, isn't it sous vide?" Like with anyway, so
the D,
you got to pronounce
soft
it.
D, yeah.
So anyway, but there are different ways to prepare without oil. We just kind of have to change the way we do things.
Well, let me ask you though, because you are using oil. You're just spraying the oil versus pouring it. So the oil is being used,
but because it has no calories or no significant calories, then you're avoiding that aspect of things.
I got it.
There's a vegetable chili recipe from Emeril that I tweaked and kind of turned it, and I'll call it the WHOLi chili, that I hope to be on the menu. That's just incredible, but it's so caloric because he had so much oil in it, and it really didn't add to the flavor or the consistency of the dish. And so we just overuse oil.
Yeah.
And there are times, and I love macaroni grill, dipping your bread in the oil with the cracked pepper.
God.
I
love it.
I love that. But again, it's calories, know. So you have a little of that, put it in the whatever section, and then try to eat the rest of it as whole plants and fatty seafood. So that's the goal. Yeah.
Well, I like it. Did we cover how you take the whole plants and make those into seasonings or sauces?
No.
How does that work?
No, so this is above my pay grade. This is where you'd have to ask Matt or Marie. But just in general, you're going to be just herbs and spices and different things are plants or made of plants.
Yeah.
So that's kind of the point that Dr. McDougall was making. But I ain't no chef, so
Yeah.
can't go into that in
Well,
detail.
Matt, if you're listening, I'd love to have you on because I'd love to know how you make a sauce out of just plants.
Well,
how that works.
Yeah, and
I'm not a sauce guy. I don't know how that works.
Cashews are used a lot for dressings.
Yeah.
You know, you just puree them up and whole avocados, you know, where you still have the fat from the avocado that they make the oil from. And so therefore it has the consistency that sticks and stuff. I've never pureed olives and used that to saute something in. I think that would be a little bit weird, but add a little odd flavor to it. But there are just ways to make things different. You can't duplicate everything. You can't duplicate directly butter, bacon, you know. And I'm not a fan of, you know, a lot of vegan foods who make fake hot dogs and stuff like that. That's kind of turns my stomach. So anyway.
Yeah, well, reading what's in it
Yeah.
and eating it, they both, have a negative outcome for me.
But so we have this cheese, and it's not even our original recipe. We bought it from somebody that's made of whole plants. It's a dipping nacho cheese sauce that is 100% healthy. Ooh, and Marie makes it, and every time she does, I'm like, please make an extra large container, and you just inhale. It's really good. So you put on broccoli and chips and dips, and we're originally going to do a Mexican food menu for our food truck, and had all but perfected the chip. And in one little comment I'll make that makes it's kind of interesting, and would love to eventually have like a Food Network, you know, contest for cooking with these kind of things. But if we can come up with the perfect chip, which is made of corn, and if you just bake it, and at the right texture, the right thickness, the right, you know, temperature, however long you have to cook it, and then season it, if that would literally change the whole game of obesity in America. Because right now, if you look at the typical Doritos or something, there's close to 1 gram of oil per chip.
Per chip?
And
really?
Yeah. And if I've done my math right, if you look at the obesity epidemic increasing over the last 30 years, I believe on average, the average American consumes around 17 to 20 calories more than their caloric needs. So it's a very slow average rise of a couple of pounds per year.
Yeah.
And that equals 2 to 3 chips. That's it.
Wow.
So if all we were to do is create the perfect chip that didn't have oil, and that's all we did, and that's what I want to do.
Yeah.
And Matt Becker has told me how to do it, and it just takes a lot of money.
Is that all?
But he one of his he's a great find, because one of his specialties is he actually is a consultant for getting food into stores. So that's one of his specialties. So I'm anxious to do this part of things.
Yeah.
Bag a chip and stick it there so you can just pull it off the shelf. It doesn't break. You know, there are oil-less chips out there, but they kind of crumble in the package and don't quite have the right texture. Don't break your tooth, or they may break your tooth, or they disintegrate. Just have to find that right one. But I'm really anxious to do that at some point.
Yeah.
And I've got the recipe, just don't know how to mass produce.
Right.
So that's hard.
Yeah. Scaling for sure.
Yep.
Yeah. It's amazing when I think about, I don't mean to digress away from like health and diet and everything, but just thinking about like setting up a system. I think about this sort of thing all the time. A big portion of my brain energy is thinking about systems, about how the logistics are set up, about how things are organized, they're engineered, how a business is created. And having started a business in the last 2.5 years now, seeing what it is to build a thing out of vapor and manifesting that into a physical, tangible thing, it's just really interesting to me to watch how, like, to hear you talk about your process. Like, we've got an amazing recipe, we've got an amazing thing, but how are we going to scale it to where it doesn't cost $80 a bag, you know?
Yeah.
How do we make a restaurant that accomplishes all these health initiatives that you want to do for the public that's affordable, which is cool that you're even considering that, because most would just put that in like Uptown or something and charge $30 a bowl, and they're happy to pay for that. But no, the general public can't typically afford that. And then just to hear you talking about just the processes and stuff. So when I think about systems, about it takes a certain amount of what were the 4 things you mentioned earlier? Because I like the way you worded that: the money, the people,
expertise, and time.
Yeah, that's all it takes, right?
All it takes, right on the cusp.
Yeah. But you're running your practice. You've got these nonprofits. You're busy, man. You're a busy guy.
Well, and unfortunately, because of how much time the other things are taking, I'm not able to dedicate the time necessary to some of those nonprofits and stuff. But they're poised and ready to go when I can find the right people and the time and stuff to march forward. So and it may evolve. I may decide, okay, that's not the right way to do it. Let's have a different mission and stuff. But we'll see. Time will tell.
Yeah. Something that's helped me, I've learned, is having an assistant. I don't have a full-time assistant, but I have, I'll say, okay, this week I need you for 10 hours or 5 hours or whatever. And I'll have her look up things, research it, because I have, I don't want to digress into that, but I have a nonprofit that I've been working on myself. I have my business. I've got the podcast. I've got other life
Making
things.
some waves. Yeah.
Yeah. No.
Awesome.
Tiny little ripples.
To.
Yeah. Ripples.
I understand.
Butterfly effect. But it's there's times where I'm like, okay, I've got a load going on this week, a big workload, but I need to see forward progress for my own mental well-being and to know that things are happening. So I'll be like, hey, can you research this? Here's a handful of things. Just go figure it out and then come back to me, and I'll make the decision on which one's better or whatever. That works for me because then I can have some kind of progress. Someone gets me all the information, and then I make a choice. And I don't know. I don't know if that'll help you or not.
Well, and so Marie is actually that person for the most part. I hired her originally as an executive assistant, and found out that she was had all kinds of
a badass. Huh?
Yeah, totally. She taught anatomy and physiology at the college level for 10 years, so she's got all these credentials and skills and stuff. And so she is that person that I kind of said, hey, I got to get some help.
Yeah.
But I had a patient one time who does really well in the real estate world. And he said, yep, I just drew a T and I wrote down the things that I do on a daily basis that I can shift to somebody else and pay them $15 an hour. And it just magically made me, a ton more productive.
Yeah.
And I haven't gotten that, good or articulate at trying to figure out what it is that I do that can be done by somebody else. But
that's the challenge.
They still cost some money too, and finding that person who is just available and has that knowledge set, I'm sure is not terribly easy.
Yeah.
But I've always had a dream of, and I've got a list and we won't go into them, but I've got all these business ideas, and I wanted one day to have enough money to be able to hire an MBA straight out of, out of training and saying, here is this project, here is this, money, amount of money, whatever you'd call that. And in 2 years, this will cover your salary and, go write up a business plan, make this fly. Come back if you need more money, whatever. And I'd love to do that because I'd love to see some of these things fly. But you just don't have enough time to do it all yourself, or the expertise, or whatever.
Yeah.
So.
Well, I think the journey's part of it. Not necessarily mastering a thing or reaching some kind of finish line, but just doing something that you love, that you're passionate about.
Yeah.
I see it. I love that you're my doctor. I love that. I love when I do need to go. I love walking into the practice and just feeling at ease about it. And so I'm glad you could come on tonight, man.
Oh, my pleasure.
This is great.
So I appreciate the opportunity.
Yeah, thank you so much. I think if anyone's interested in learning more, we've got TLCFamilyHealth.com. What else? What else can we look at?
Yeah, so slimtlc.com is the lifestyle and weight management program.
Okay.
These are the active things. We're getting ready to launch a low price, low T.com, which also directs you to a page on my website. I'm getting ready to find a
testosterone stuff.
Yeah, so trying to get a landing page that doesn't just show that. But yeah, if you go to low price, low T.com, low price.
I think we got low, yeah.
Yeah, low price. It's so low. SelfEmployed.com. And you'll see that. So we're getting ready to launch that here in a little bit. I've been talking to the guy who puts my signs up.
Is that still?
That's, yeah, okay. So
There we go.
I want to put that sign on the front of my building, but I found out that that's apparently not allowed by Flower Mound. So we're trying to figure out if we're going to do something different. But
so you're going to be doing testosterone stuff? That's cool.
Yeah.
I'll be talking to you about that.
Well, it's a... there's an opportunity to help people feel better for a lower price than people are currently doing it right now. So
that's cool. So we got the family practice, the slim TLC family, or the low T coming out soon.
Yep.
Is the nutrition star?
Yeah.
.org.
.org. nutritionstar.org to learn about that part, and
the
WHOLi KaBOWLi.com, kind of spelled a little differently.
Yeah, so that's that's not out yet, but you're gonna. Where can people go for the fundraising? Is that an active thing?
Yeah, so not yet. So Kickstarter, literally, we're knocking on the door. So it'll be by the end of this month that I'll launch that, and I'll put it on my TLCFamilyHealth.com Facebook page. I'll put it on my WHOLi KaBOWLi.com, my SlimTLC.com, or sorry, just leave the .coms out, but those Facebook pages, and hopefully Instagram associated with them. So
cool.
Hoping that people. I've been talking about it now for 8 years and had enough people express interest that I'm hoping that people will share it with everybody and hopefully raise enough to fund it. So.
I love it. Yeah, I love the holistic nature of what you're bringing to the people, and it's good stuff. So thank you.
Appreciate it. Thank you.
Appreciate it.
Right.
See ya. Bye everyone.